Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is the first Monday of the month, which means it's time for McDougall Monday, where we are going to get a brand new lecture by Dr. John McDougall, and who knows, we might even see Mary, and then you'll also have time to ask some questions. So today, Dr. McDougall is going to be giving a brand new lecture on hypertension, and he's going to be discussing drugs versus diet. Please welcome Dr. John McDougall. It's always great to see you.
Well, thanks, AJ. Charles, you got the record button on because we're going to do this just once.
No, it's fun. You don't see him, but we have this system where he lets me know that it's working.
Well, I just want the audience to know that Chef AJ and Charles have given me an opportunity to put together a series of lectures, which are basically what I'd like to be able to tell you if you were my patient, about different problems that you have. I know you get all kinds of stories and you don't know what to believe. And, the information has generally not been provided for you in a user-friendly and succinct manner. So I've done these 1-hour lectures, and this will be, I don't know, 6 or 7 in a series. We did breast cancer, heart disease, diabetes, autoimmune diseases, obesity. So I don't know, we're getting right on there. I'm kind of gotten most of the important subjects of problems that people come to me with. Those are, overweight, high blood pressure, diabetes, heart disease, and cancer. That's essentially it. I should also do one on GI disease. Maybe we'll do that sometime in the near future.
That's one that we get a lot of questions on, Dr. McDougall.
Well, it's one that needs to be addressed because people believe that what you put in your intestinal tract has little or nothing to do with its health. And of course, that's just plain and simple, not true. So let's go on and see if we can get a presentation up here. That'll be fun.
Well, you've always said it's the food, and all the diseases seem to have a link to the food.
It's the food. Yes, it's the food. It is so, it's so hard for people to get their minds wrapped around it because we've gotten so much education from food industry, from the drug companies, from the doctor businesses, and so on, that have taught us to not look to food to the cause and solution of our problems. But it's so obvious. I mean, if you were a farmer, you were growing crops, would you be concerned about the soil? So as a doctor, I'm concerned about the soil. I want to know that you're being grown the right way, and food is basically everything. Even problems like lung cancer have a relationship to food, and skin cancers, and all kinds of problems are related to food, at least in part. What I'd like to talk to you about is hypertension, high blood pressure. And this is the frank discussion that your doctor should be having with you if you have concerns about your blood pressure. Probably you know that high blood pressure leads to strokes, doesn't lead to heart attacks, leads to heart failure. And what we're going to discuss is the fact that high blood pressure is really not a disease. It's a sign of underlying sickness in the body. And we could take care of it with drugs, or we could take care of it with diet, but there's only really one way to take care of it correctly, and that is you must deal with the food because that's the cause. An article I just recently read called Timeline of History of Hypertensive Treatment. Interesting discussion about high blood pressure. And what they noted in there was that it was written in 2016, this particular article was. They said that it is surprising that only about 50 years ago, hypertension was considered an essential malady. In other words, something kind of to be expected and not a treatable condition. And the first drugs that were introduced were the diuretics, the thiazide diuretics, and they were introduced in the late 1950s. So, my 54 years of practicing medicine, I've been exposed to this study by study, treatment recommendations by treatment recommendations. I've followed this all along in real time. And I'd like to share with you what I've learned and what I've come to understand about high blood pressure. Your blood pressure is something you can measure. And again, they've only been measuring it for about 50 years. Just when I started practicing medicine came the technology to do that. And that's with a stethoscope and a blood pressure cuff. Now, one thing you want to note from the beginning is that the blood pressures you get at home are the ones that doctors should be counting on. Not the blood pressures you get in a doctor's office. Too often you're excited, you're afraid, you're anxious, and your blood pressure is artificially raised in that kind of office setting. So when you go to manage your blood pressure, whether it's to see whether or not you have the condition or if you're in the process of treating it with diet or drugs, you want to take the measurements at home, write them down, discuss what you find with your private medical doctor. I think once a day is enough. I mean, if you're a healthy person, maybe once a year you should check your blood pressure. But if you're ill with problems, particularly those related to high blood pressure, then don't check it 5 times a day or 10 times a day. Once a day is plenty. Your morning reading is going to be your highest reading. So on average, so throughout the day, your blood pressure generally comes down. The measurement of high blood pressure is something very convenient and relatively inexpensive these days. You could go to most pharmacies and you can buy a blood pressure cuff, an automatic one, where you don't have to use a stethoscope. And they cost between $20 and $75. Now, let me take a minute and tell you how this works and what we're listening to and what it means. You see the picture of the arm here and something labeled the brachial artery. If you put the cuff around the arm above the brachial artery, like you see positioned here, and then you blow up the cuff and you listen with a stethoscope over that brachial artery, what will happen is the sound of the blood flow will disappear. And that's because the artery is completely closed, so no blood gets through it. And then you start decreasing the pressure in the cuff. And eventually you reach the highest pressure in the system where the blood can finally get through the brachial artery and you hear the slapping sound when you put the stethoscope just distal to the cuff over the brachial artery. It slaps, blum, 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 like that. And then what happens as you continue to lower your cuff pressure is you reach a pressure, the lowest pressure, which is diastolic. The lowest pressure is when the blood vessels no longer slap together. They're constantly open because you reach the lowest pressure in the system. And that's what blood pressure is. It's a reading of the highest and the lowest pressure in the system. It's easily monitored, easily measured, safely measured. The only problem is what you do with the information. Then you can get into trouble or get out of trouble. Now, as far as readings go, I would say pretty much a normal blood pressure would be considered 100 to 110 over maybe 70 to 80. Those are generally the figures. And those are typical of Americans, which are in general sick people. If you look at other populations, for example, you look at rural Africans, still living on a starch-based diet, you'll find their blood pressures will run 70 or 80 over 30 or 40 millimeters of mercury. And of course, they're in excellent health. As the system becomes ill, which is what causes the blood pressure to go up, as the cardiovascular system becomes ill, the numbers you get when you check with a outrigger like what we have right here, a blood pressure cuff and a sphygmomanometer, the pressures go up. And a high blood pressure might be considered 180 over 120. Actually, I would consider that malignant hypertension, which needs pretty prompt treatment. Malignant hypertension does. And then as you get better readings, we still consider those high blood pressure, like say 140 over 90 millimeters of mercury. Again, considering a normal pressure being 100, 110 over, say, 70, 80 millimeters of mercury. And that's what they tell you here is a normal blood pressure is 120 over 80. Those are the kinds of numbers that you'll be getting. And again, remind yourself through this lecture that a very, very high blood pressure is 180 over 120 millimeters of mercury. How common is high blood pressure? Well, at least 20% of the population has high blood pressure. And one piece of data that I read, 40% of people over the age of 25 have an elevated blood pressure. And this is a major risk factor for the condition of your arteries. This is not a disease. It's a sign of the condition of the arteries. People don't die of high blood pressure. You know, in my whole career of 54 years, I've never seen anybody die of high blood pressure. In fact, the only thing I can imagine that it would look like death by high blood pressure would be a reflection of a movie I saw in 1981 called Scanners, where aliens, with telemetry, they would get us native people on Earth all excited, and we'd shake, and eventually our heads would explode. I mean, is that what dying of high blood pressure is like? If it is, I've never seen it. It's a silent disease, so to speak. That's the only thing I could picture is that Scanners movie. If people actually died from elevated blood pressure, it would be an ugly thing. Why does the blood pressure go up? Because it's supposed to. It's a normal reaction that the body has. It's an adjustment that it makes as the cardiovascular system becomes ill, sick. And that's due to the food. And the most serious manifestations of this sickness of the cardiovascular system would be a failure in the brain, in other words, a stroke, or a failure in the heart. Well, that might be a heart attack, but more commonly it would be heart failure. In 1985, I published a book called McDougall's Medicine, A Challenging Second Opinion. And I worked for 6 years to put that book together. And fortunately, many years later, I could tell you that there's not a word I'd correct in that book. It's an excellent discussion of medicine up until that time. But the important thing for you to understand is very little has changed since 1985. And in my chapter on high blood pressure, by the way, you can have this book for free. Yeah, all you do is you just go to our website, you go to our shop, you know, where you buy things, and you enter this particular book, and there are a few others of them that I own. And when you get to checkout, there's no charge. You can download it for free. Anyway, in the chapter on high blood pressure, what I say is the blood pressure goes up because of excitement. Like if you're afraid when you go to the doctor's office, or if you exercise, or you drop a bowling ball on your foot. Due to excitement, the pump pumps harder and faster, and the pressure goes up. Well, this isn't associated with any bad health, is it? The other reason the blood pressure would go up would be is if you overfill the system with fluid. And what we're talking about here is eating a lot of salt. When you eat a lot of salt, that brings in water into the cardiovascular system, and that causes the blood pressure to go up. And that's of some importance, and it gives you also something to do. You can go on a low salt diet to help with your elevated blood pressure. There's something even more important than that. And that's the last drawing that I put in this book back in 1985. That's about peripheral resistance. And that's the important thing. And that's what we're going to be talking about, is the blood vessels become narrowed and the blood becomes viscous. And as a consequence, we create peripheral resistance, which causes the pressure to go up. It's like when you're out watering flowers and you decide you want to water something 10, 15, 20 feet away, but you don't want to walk over there. What do? You put your thumb over the end of the hose. You increase the resistance to flow and the pressure goes up. That's what high blood pressure is measuring, is the resistance of flow in your cardiovascular system. A part of that resistance to flow has to do with atherosclerosis. We have the pipes, and the pipes get diseased. It's called atherosclerosis. And the walls get thickened, and you develop pustules and scar and calcium and all kinds of things that narrow the lumen of your arteries throughout your entire body. We're talking about 60,000 miles of vessels, and many of them are larger vessels, and you can see this change that occurs. So as life goes on, for the typical American who eats the rich Western diet, you have narrowing of your arteries. Of course, fortunately, you can reverse this. Eat a good diet, and you show regression of the arteries, and the pipes open up a bit. The other thing that causes the arteries to narrow are spasms. These are made of muscles, these arteries are. And there are certain things that we eat, like bad cholesterol, that cause the artery walls to go into spasm, again, increasing peripheral resistance. And then there's this thing that we do 3-4 times a day that increases peripheral resistance. We cause the blood to become viscous. It's sludging of the blood. And you see here the flow of blood, very rapid. In this situation, before a meal, the blood cells hit and bounce off each other. They negatively repel each other so you have a good flow. And then you feed the fat. And what happens is this. You see the blood cells now stick together. There's all kinds of sludge. You can see the tremendous increase in peripheral resistance that occurs. One thing I want to point out here is that vegetable fat, your health food vegetable fats, they cause more severe sludging and more prolonged sludging of the blood than do animal fats. And this sludging lasts 6, 8, 10 hours a day. Well, the typical American eats one high-fat meal after another every 3 or 4 hours. So their blood is constantly in this viscous state. We see this in human experiments. For example, you see the setup here with a microscope. The doctor's looking in the whites of the eye of a apparently 44-year-old fireman, and you see a picture of the blood vessels of the white eye on the left there. And you can see there's lots of blood flow, very relaxed blood vessels. And then the high-fat meal is fed. This is 67% of the calories is fat. Typical meal that I've eaten, that many of you have eaten in the past. The oxygen, what we call oxygen tension or oxygen content in the blood, drops 20% after a single high-fat meal due to poor circulation. So sounds like high blood pressure is bad because it hurts the arteries. I would understand if you went to that conclusion. Is pressures are pressures, and they cause damage and stretching and so on. And normal blood pressure being 120/80, as the pressure goes up, we see an increased risk of dying of heart disease. And we come to the logical, although incorrect, conclusion that what is happening is the pressure itself is damaging the arteries. No, it's backwards. It's the heart before the horse before the cart type thing. And healthy weightlifters, double leg presses, if you measure their blood pressure while they're lifting the weights, their blood pressure goes up on average to 320/250 millimeters of mercury. And in one subject in this particular paper, the blood pressure went to 480/350 millimeters of mercury. Not a single blood vessel breaks. Healthy blood vessels don't break. Please understand this. Well, let me take it a little bit further. In this particular experiment, investigators, they used a custom-made motorized syringe to raise the pressure in cadaver arteries. They took arteries from 10 people who died, fresh arteries, and they put their syringe pump into one end of the artery, closed off the other, and raised the blood pressure in the arteries, for example, in the aorta, which is the big blood vessel in the central part of the body. They raised the blood pressure to 3,000 millimeters of mercury before the blood vessel broke. And in medium-sized blood vessels like those that are present in your brain circulation, your cerebral arteries, the average blood pressure that would cause a rupture in the artery wall was 1,786 millimeters. Healthy blood vessels don't break. Probably the extreme of putting pressure on blood vessel walls is when the cardiologist goes in with their catheter and they blow up a balloon. And the vessel walls don't break, yet they blow the balloon up to a pressure of 12,000 millimeters of mercury. Healthy vessels don't break. High blood pressure does not cause damage to the vessels. High blood pressure is a reflection of the health of the vessels. When your pressure goes up, you're talking about your circulation being sick. You're talking about the heart, the blood vessel walls, and the blood itself being unhealthy. And as a result, you die from the consequence of unhealthy arteries. not the pressure. Let's do a little summary here. Here you see a large opening where you begin with a black arrow. You begin with a large opening, and you have very strong vessel walls. And then as life goes on, you cause progressive damage to the walls. And what happens is they enlarge and they close the lumen. So the lumen becomes a smaller diameter, increasing the peripheral resistance. Pressure goes up as a consequence of the arteries becoming sicker. And eventually they get to a point where they're so sick that we have rupture of plaques that cause heart attacks and strokes. And we talked about this in our lecture on heart disease, about how you have a heart attack from plaque rupture. And most strokes are also due to plaque rupture. You see that right here. Let's see if we can find the picture. Yeah, what happens is the pustule breaks. All right. So the rotten arteries, they fail. And at the time they fail, the blood pressure is up because the arteries are so sick. All right. So you should understand by now that high blood pressure is not the culprit. High blood pressure is a sign of the health of the arteries. Well, okay, the body naturally regulates the blood pressure. It has to go up because the heart has to deliver blood and nutrients to the tissues. And we have that increased peripheral resistance to deliver the oxygen, to deliver the nutrients, to take away the waste products. In order to do that, the system has to raise the blood pressure. It's normal, it's natural. And the body regulates the blood pressure just perfectly fine until you start introducing drugs. And then what you do is you paralyze the cardiovascular system in various places. And as a consequence, you develop abnormally low blood pressures. I mean, normal would be the blood pressure would be up, right? To try and compensate for all the disease. You give a drug to lower the blood pressure. Well, we just talked about how the blood pressure is not the problem. Okay, the blood pressure elevation is the result of the problem. So you interfere, as we do in the medical business, and you cause the blood pressure to go down with medication. And what we're going to talk about here is only a circumstance where people are on medications. I don't care how low your blood pressure goes if you're not taking medications, as long as you're not sick, as long as you're not injured and bleeding to death. It's normal, it's natural. The blood pressure will go low to levels where the bottom number may be 50, 60, 70. The top number may be 70, 80, 90. And it's normal, and it's safe, it's just fine, as long as you're not causing it to go low with medication. Let me explain to you what happens here. This is a look at the systolic blood pressure, so the top number, in relation to dying, overall mortality. And you see here the top number. Remember, the top number is 110 or 100 or maybe as high as 120. You see up here very high top numbers in the 220, 240 range. That indicates a very sick cardiovascular system, and these people have very high risk of dying of congestive heart failure or having a stroke. Well, in this case, where you're dealing with these very, very high blood pressures, if you lower the blood pressure with medication, in other words, you lower it artificially, and you lower it down to about 140 millimeters of mercury, you see a reduction in risk of dying. And this is important. And this is where the medical profession can have some bragging rights, because when blood pressure pills were initially used, they were used for people who had malignant hypertension. These are people that were very, very sick. There was a study called the Veteran Study, and they gave them diuretics, and they saw that they reduced the risk of sudden death and congestive heart failure. All right, so you lower the blood pressure with medication down to, we're talking about the top number, remember, down to around 140. If you lower it further than that, say down to 120, 100, 80, 60, you increase your risk of dying. Overtreating high blood pressure is harmful with medications. One thing that happens is you have an increased risk of fractures and falls. The other thing is that you're working against the body's normal reaction to a diseased cardiovascular system. In other words, your heart and lungs, or excuse me, your heart and brain need some extra pressure because they're all clogged up, right? Well, you go in with the drugs and you start lowering the pressure, and now the perfusion pressure to critical organs like the brain and the heart have been compromised. And so you have an increased risk of stroke and heart attack by artificially lowering the blood pressure. And here you see it in terms of the top number, systolic pressure. 3 or 4 times is great. Your chance of having a heart attack when you get down here to a blood pressure of 60, which many of you consider normal, and some of your doctors try and get you to do to lower your pressure down to 60 or 70 or 80 with the drugs. The more the better. We've got to try and make you normal. Well, when you do that and you pass, say, in this case, the top number down 140 down to the top number being, say, 80, 90, or 100, you increase your risk of strokes by 2 times. The risk of dying of heart attacks is increased by 4 times. And here it is in terms of looking at the bottom number. You see the same, what we call J-shaped or U-shaped curve of mortality. In other words, you take care of very sick people. In this case, they're talking about the bottom number being higher than 100. You start giving your medication and you lower the bottom number here to around 80 to 90. And this is the bottom of the trough. This is when you see reductions in stroke and congestive heart failure up until about, say, 80 or 90. And then as you aggressively treat the blood pressure and you overtreat the blood pressure, what happens when you get down to normal, say 70, or super normal, say 60, you increase the risk of strokes by 200%, the risk of heart attacks by as much as 400%. It should make sense to you. The heart and the brain need to have a flow of blood that's adequate. And these drugs artificially reduce the perfusion pressure to these critical organs. Overtreatment is dangerous. So what's the sweet spot? What's the target for lowering blood pressure? As a doctor, I have to take care of people who have elevated blood pressure, and I don't want to undertreat them, and I don't want to overtreat them. And so what I use as a target is about a blood pressure of 150 over 90. All right. It would be too high. In other words, they need more medication if the blood pressure was, say, 160 over 100. And I'd be overtreating if the blood pressure was below 140 over 80. So this is what your doctor should be treating you for, a target blood pressure where you have the least chance of having a stroke or heart attack. And that number happens to be on average 150 over 90 millimeters of mercury. You do not want to be treated to a normal level, not with drugs. All right, let's take a look at recommendations from major organizations and see how that fits in with what I just tried to tell you. The Cochrane collaboration. The Cochrane collaboration involves 40,000 experts, scientists, doctors from around the world, and they're in over 100 countries. And they're the most respected organization when it comes to looking for unbiased information. I rely on them a lot. In the Cochrane collaboration, when they reviewed the treatment of high blood pressure, what they said is treating patients to lower than standard blood pressures. In other words, 140 to 160 over 90 to 100 does not reduce mortality or sickness. Morbidity is illness. So they say you should not lower the blood pressure below, say, 160 to 140, and the bottom number being 90 to 100, which fits in with the target that I just showed you. The British guidelines, which came out originally in 2004, and they still hold today, they say that you shouldn't start treating a person with high blood pressure with medication unless their blood pressure is sustained. That means for months at 160 over 100 or greater, because there's no benefit. The Heart, Lung, and Blood Institute, they come up with some recommendations every few years with their expert panels. This is the 8th, which is the most recent Joint National Committee on recommendations of what we should treat with medication now, people with high blood pressure. And what they say is this is the newest guidelines. They say people younger than 60, you should treat them to a blood pressure of 140 over 90 or higher. Somebody my age, at 60 years of age, they've upped the number recently. They used to say even people that are older should be treated to, say, 140 over 80. They now say that the goal, the target should be on medication, a blood pressure of 150 over 90 or higher, not lower, or higher. So the explanation I gave you for what you ought to do with blood pressure medications is consistent with what your doctors are being told they should do as far as treating you. Unfortunately, doctors are influenced by a lot of things, and they're too often not in your best interest. So we have ways of lowering blood pressure, and they were introduced in the late 50s, when I was a young doctor. And these are various medications, and the medications fall into 5 classes, and I'm going to spend a little bit of time on these with you. There are diuretics, and they work by poisoning the kidneys and causing the kidneys to lose fluid. Poison is the correct terminology. Poisons disrupt the normal body functions through chemical reactions. I'm just saying this for its emotional value. This is the right word, poison. Beta blockers, they poison the heart muscle, so it becomes weak. In fact, people on beta blockers, they'll often complain that they can't walk upstairs because their muscles are so weak. So beta blockers, they block the adrenaline, which is a powerful hormone that causes the heart to beat strongly. And in that way, they weaken the heart and they lower the blood pressure. ACE inhibitors, they're one of the poisons that affect the adrenal output and the hormones. They prevent the production of angiotensin II, which is a hormone which constricts the blood vessels and raises the pressure. So ACE inhibitors, they're poisons of the adrenal gland. Angiotensin receptor blockers, they work at another level as far as the adrenal system goes. They block the action, not just the production, the action of this powerful hormone, angiotensin II. They're not the same drugs. Doctors will often interchange them, ACE inhibitors and angiotensin receptor blockers. They're different medications with different risks. And we'll talk about that in just a minute. And then there are calcium channel blockers, which are poisons that poison the blood vessels so they relax. So you poison the system at various areas, and often you poison the system 3 or 4 or 5 different ways. And what happens is you artificially decrease the perfusion pressure to the brain and the heart, and you increase your risk of dying if you treat too aggressively. Now, let's talk about how I treat my patients with high blood pressure. I use the drug that was first tested, and the only one really that we can substantiate works to reduce the risk of stroke and heart failure. The drug I use is called chlorothalidone. It was introduced in the late 50s. It's not the same as hydrochlorothiazide. I know you think it is because they're both diuretics. It's not the same. It was chlorothalidone, which this paper was a result of. It was major outcomes in high-risk hypertensive patients randomized to angiotensin-converting enzyme inhibitors, calcium channel blockers versus diuretics like chlorothalidone. And guess what? It was the chlorothalidone that worked and the others didn't. But there are a couple of papers here you might want to read, and I know many of you are going to go back and watch this presentation and look up the studies and see whether or not I presented them to you accurately and without exaggeration. And you'll find that there's darn good evidence for you to be treated with chlorothalidone as opposed to hydrochlorothiazide. That's what I use, and there are reasons why. I don't use calcium channel blockers. The main reason is adjusted risk ratio for myocardial infarction and heart attacks was increased by about 60% among users of calcium channel blockers. So you add these calcium channel blockers to the system and you increase your risk of dying of heart disease, which is what you're trying to accomplish, is not die of heart disease. I think these drugs should never be used. They increase your chances of suicide by 5-fold. They cause you to be constipated. They're associated with a risk of overall cancer and specifically breast cancer. No reason to use this kind of medication. Well, there is a reason, of course, because, you know, they're brand name now, but they came out as, they're generic now, but they came out as brand name drugs. So what happens is we have the original medications, which are a brand name. We can charge a lot of money for them. And then they become generic, and not that they lose their benefits, but they get pushed aside for the new brand name drug, which you can charge exorbitant amounts of money for. And that's how new medications become popular. It's not that the old medications don't work. It's just they're not as profitable. So I never prescribe calcium channel blockers, and I never prescribe angiotensin receptor blockers. Remember, I told you that your doctors often confuse ACE inhibitors, which stop the production of angiotensin II, and angiotensin receptor blockers, which prevent the hormone from acting at the tissue level. Now, doctors think these are the same medications. In fact, they think that ARBs are better, angiotensin receptor blockers, because they don't cause the troublesome side effect of coughing as much. So likely you've been switched from ACE inhibitors to angiotensin receptor blockers, but not in my practice you wouldn't be, because I don't use this drug. So sick people take medications. Let's get down to it. Healthy people don't. And you want to do what you can to safely get off any medications you're on. In this case, we're talking about getting off blood pressure medications. This is how I do it with my patients. I get them to change their diet. They check their blood pressures at home. They need to be prepared for a precipitous drop in blood pressure. I mean, you stop the viscous nature of the blood sludging, and in a matter of hours, you decrease peripheral resistance. So be prepared. You may end up with a really low blood pressure really quickly. And what that means, you have to lower your doses of medication so you don't become hypotensive, get in an accident, fall over and hurt yourself. You want to avoid hypotension, too low a blood pressure. So you check your blood pressure in the morning because that's where it's going to be the highest. You exercise a little bit, but not too much. You should not start an intensive exercise program until you've established a good diet. There are many reasons for this that we could talk about. I reduce medications one at a time. Often people come in with a whole bag full of drugs, and they'll be taking multiple doses of the different high blood pressure pills. And so I start with what I think are the most dangerous, which would be the calcium channel blockers and the angiotensin receptor blockers. And we just plain and simple stop those because they're just too darn dangerous. And then what I'll do is I'll slowly reduce the other medications that the patient is on. Maybe cut the dose in half every 3 or 4 days, maybe quicker. If their blood pressures are coming down quite quickly, I'll often stop the medication all of a sudden. And you could do that with blood pressure lowering medications, except for maybe beta blockers. Beta blockers, you may want to stop a little bit slowly because the body adapts to beta blockers. And at the very least, when you stop them rapidly, you might get a rapid heartbeat. It could be troublesome to you, at least worry you. So otherwise, I have no hesitation at all stopping these medications. And of course, I have a lot of experience doing this, having done it for close to 50 years. I feel very comfortable about doing it. So we reduce one medication at a time, maybe cut it in half every 3 or 4 days. If the blood pressure is lower than 150/90, then I get a little bit more aggressive at reducing the medications. But whatever you do, you don't want to be in a situation where you're being overtreated. You end up with a blood pressure so low that you get in an auto accident or you fall over and hurt yourself. It's safer to have too high a blood pressure than too low a blood pressure. I know that's hard for people who believe so much in drugs. But when you're managing medications and trying to get people off, you have to be aware of the consequences and make the right moves. And by the way, this is not difficult. You know, I teach doctors. We had as many as 7 doctors working for us at the clinic when we used to take care of companies like Whole Foods and other companies that came and brought their employees to us. I had as many as 7 physicians that worked with me. Now, all of these were really good doctors, of course, board certified physicians. But I could teach them how to reduce the medications in like 5 minutes. I'd give them a sheet on what I thought they had to do with medications, and they'd read it over and they'd use their own judgment. But pretty much by and large, they would do this and find out the patients turned out really, really well. So it wouldn't be hard for your physician to learn how to take you off medications. But the difficulty is in the fact that we have no education on reducing medications. Doctors don't know how to do it. In fact, they're taught by the drug companies to never do it. You're told, the doctor is told, and you're told by the doctor that once you're on these medications, you're on for life. I mean, think about it. Yeah, you are on for life unless you fix the problem, which is the food. But if you decide to go that route, then you're going to have somebody supervise, give you a little hint on how to reduce your medications. You know, it's not that there haven't been many people who have done this without medical supervision. It's just that I have to advise, of course, that you have a competent, trained healthcare provider helping you make the decisions. What do you do with the extra drugs? You know, most of my patients start up with a whole bathroom cabinet full of medications, and they don't need to take them. No, we get 90% of people to reduce or stop their medications, particularly high blood pressure and diabetic medications, in 7 days. What do you do with these drugs? Don't throw them in the toilet. These are poisons that will affect the fish and other sea life and pollute your streams and lakes and oceans. And I'm serious. You need to take these drugs to your local pharmacy where they'll put them in a toxic waste depot and dispose of them that way. Now, I want to mention, you really want to be off medications. Sick people take medications. Healthy people don't. People who had lots of sickness, they have a checkerboard abdomen with the scars from their previous surgeries. Sick people, they have doctor's appointments, you know, every month or 2 or 3. And they're the ones that support our local hospitals. Yes, they do. You don't want to be in that particular business. You want to get out of the system, get out of the medical business. The only way I know that you can get out of the medical business is to stop being ill, to regain your health, to fix the problem, and the problem's the food. I mean, think about it for a minute. Doesn't it make sense? You don't want your best friend to be your doctor? I mean, I don't want morticians in my life. I don't like it when I have lawyers working for me because I know I'm in trouble. Why would you want to have physicians as your best friends, as somebody you have littered on your calendar to see? Get out of the business. All right, let's talk about dietary therapy. I told you about the drugs, told you the drawbacks of treating with medication. You really never get healthy. What you do is you temporize some of the problems, you treat the signs and symptoms, but you never get your health back. You're just an overweight, sick person carrying around a bag full of drugs. So to fix the problem, you gotta fix the food. And fixing the food means more than just lowering the sodium content of the food. You've got to change the entire diet. You've got to eat a starch-based diet. Probably the best example that I can give you about how it's not the salt is to give you the example of the bacon. It's the pig that's making you sick. It's eating the pig. The only way they can get you to eat the pig, because it's so disgusting, is to load it with salt. We call this non-discretionary sodium intake. It's about 75% of the sodium you eat. You don't even have any choice. It's in your cheeses, in your meats, in your sausages, etc. That's how you get the sodium, but it's not really the salt. It's the vehicles that they're delivered to you in the things on your plate, the bacon, the cheese, etc. Now, let me show you how ineffective lowering salt intake is in terms of solving a blood pressure problem. As an average, a whole bunch of studies were put together, and it was determined how much lowering salt intake would have an effect on your pressure. And so what the research showed, and again, it's based on many studies, is if you reduce sodium intake by 1,725 milligrams down to 2,300 milligrams a day of sodium, which is what's recommended, that maneuver, which is to take about, maybe 3/4 of a teaspoon of salt out of your diet, that maneuver results in a reduction of the top number by 1 to 5 millimeters of mercury. Hardly detectable. And the bottom number by 0.6 to 3 millimeters of mercury. Hardly even detectable. So if you're going to focus on just salt out of your diet, you're not going to solve the problem. You got to get rid of the vehicles that the salt comes in, like the bacon, the roast beef. Anyway, the most impressive low sodium diet experiment that was ever done was the DASH diet. And doctors talk about this a lot, about the DASH diet. It's basically the Mediterranean diet, and they took the salt out of it. They fed 3 levels of sodium intake, 3,000 milligrams, 2,400 milligrams, and 1,500 milligrams. And again, what they saw just by variation in salt was only a tiny reduction in blood pressure. For those people who had significant high blood pressure, the drop was 11/5 millimeters mercury. For people who didn't have high blood pressure, taking that much salt out of the diet, cutting it in half from 3,000 milligrams a day to 1,500 milligrams a day, the reduction in blood pressure was only 5/3 millimeters of mercury. Your blood pressure varies that much when you get up or sit down or stub your toe. If you want to talk about the effect of serious sodium restriction, we need to talk about Walter Kempner. He's one of my mentors. He's one of my heroes. He's the doctor that taught me how to practice diet therapy. He's a doctor who made me very comfortable about the foods that I chose for you to eat. He's the doctor that showed me that diet therapy is the most powerful therapy that there is. Walter Kempner, he was an internist, came from Germany, worked at Duke University in Durham, North Carolina for 70 years. His results are amazing. Decreased heart size in patients, stopped the loss of kidney function, improved their kidney function, cured diabetic retinopathy, cured essentially all of his type 2 diabetics. People who were in such severe heart failure that their heart was enlarged to the size of their chest cavity. He put them on the Kempner diet and get these people back living again. Well, he fed a very, very low salt diet. In fact, sodium was the big deal for Walter Kempner. His diet also happened to be vegan, high starch, low fat. What he fed his patients as a therapeutic diet is he fed them a diet of white rice, fruit juice, and table sugar. If you were a really trim patient and you were at risk of losing weight on the Kempner diet, they would add as many as 2,000 calories of sugar a day, white sugar, to the diet. This was a 93% carbohydrate diet. Carbohydrate coming from rice and fruit juice and sugar. Very low fat diet. Walter Kempner, I hear, used to wash the white rice just to get some extra sodium off of it. His diet was far less than 500 milligrams of sodium a day, but the results were profound. Well, let me just tell you about the blood pressure results. He took care of, this was before the drug came in. Remember I told you the drugs were first started in the late 50s. Well, Walter Kempner was the only game in town. People would come from all over the world to get the Kempner treatment. And he get people with malignant hypertension. Now, people who are ready to have strokes and go into heart failure, they're really sick. And he put them on the Kempner diet, and he got 60% of the patients to develop normal blood pressures just by feeding them the diet. You want to talk about lowering blood pressure profoundly, you do it with the Kempner approach. And that severe sodium restriction has a big effect on the cardiovascular system. Might not be all positive, but it has a big effect on it. And Walter Kempner was one of the first people who demonstrated reversal of artery disease. Remember, through this lecture, I've talked to you about how the blood pressure goes up because the arteries are clogged. They're sick, they have atherosclerosis. Well, in addition to the lower sodium intake, his program cleaned out the arteries, as you see by this EKG. The EKG, if you look at the far left side, you see what we call an ST depression. That means the heart muscle is not receiving enough blood flow. It's not getting enough oxygen. This dip right here, that's what it's telling us. And a normal would be the ST segment being upright. Well, look at this patient. You see in the left-hand side, the ST segments are reversed. This man has serious blockages of his arteries. And a few months later, you see that the ST segments are upright. So not only did Walter Kempner lower the blood pressure by severe sodium restriction, he made the arteries healthy again. And you can do that too. Well, let me tell you what we do at the McDougall program is we serve salt. We have salt shakers on the table. We don't put salt in the food because when you mix up the salt in the super stew, the taste disappears. But we'll serve the super stew very low salt with a salt shaker there for you to put a little bit of salt on the surface of the food where your tongue tastes it. The basic McDougall diet is made up of about 500 milligrams of sodium. If you add a half a teaspoon of salt a day, that's another 1,100 milligrams of sodium. A half a teaspoon of salt on the surface of the food is a lot of taste. And now you've brought the sodium intake from the McDougall diet, 500 milligrams plus 1,100 milligrams, you brought it up to 1,600 milligrams a day. This is a very low sodium diet by most people's standards. If you have a massive heart attack and you end up in the intensive care unit at your hospital, their low sodium diet is 2,000 milligrams of sodium, which is 400 milligrams in ours with a half a teaspoon of salt added to it. And boy, do we get results. You look at the people with high blood pressure. I showed you those on the DASH diet who had high blood pressure. Well, we get even better results than the DASH program. Starting with people who have blood pressures of 140/90, and most of these people are on medication. The drop in blood pressure is 18/11 millimeters of mercury. And most important for you to notice is that we took them off their blood pressure medications. In almost all cases, 90% of the people in our program, studied over 10 years, 1,703 people, 90% of people were able to reduce or stop their blood pressure medications and their diabetic medications and most other medications just in 7 days. So this is my approach. If you came to see me with high blood pressure, and I hope your doctors at least look at this as a possibility for caring for you. If the doctor didn't want to do it, or you decided you didn't want to go through this type of change, there are lots of doctors out there who'd be very happy to give you drugs in the 7-minute visit you have with them. It's a good business, folks, pushing drugs. Believe me, I've been in this business long enough to know how to make money. So I put people on the strict McDougall diet, and if you're not overweight, this may include some nuts and seeds and avocados. If you're overweight, well, weight loss is part of the reduction in blood pressure and the improvement in general health. So I restrict the nuts and seeds and avocados. I allow you a half a teaspoon of salt on the surface of your food. But if you're not responding as rapidly as I'd like, I may ask you to cut the salt out completely, but that's a problem because that's what you like. You love the salt. If you're not enjoying the diet that we put you on or many other people put you on, it's because you're missing the salt. Just put the salt on the food and all of a sudden, voila, what a great recipe. Best soup I ever had, best stew I ever ate. Just put the salt on the food. We want you to eat the food. So you have high blood pressure? Well, let's just say you came in on a whole slew of drugs. I'm going to switch you over to chlorothalidone because that's the drug that was tested that shows the benefits. The other drugs lower blood pressure, but as far as reducing the risk of having a massive stroke or heart failure, it's only chlorothalidone that's been tested and shows benefits. So I'm going to use chlorothalidone, and I won't have to use much. You know, the 10 milligram tablets, I might have to have you split them in half. And you'll take that medication to lower the blood pressure down to maybe 160 over 100. That's when you initiate drug therapy. Remember, the British guidelines said so. The Cochrane collaboration said so. And probably the Joint Commission said so too. So if you run a higher blood pressure than 160 over 100, I'll put you on a little bit of chlorothalidone. Hopefully I'll be able to stop the other medications. And I'll treat you with medication with the goal of getting your blood pressure down to, let's say, 140 over 85. I gave you a range here, 130 to 150 over 80 to 90. Well, that's a tough job to monitor the blood pressure and get it in such a narrow range. I'll tell you, that's difficult. I'll adjust your medications every 4 to 7 days. See how you do. Give you a chance on this dose. Likely you're going to require fewer drugs after 4 to 7 days. Monitor your blood pressure at home. You'll check it and you'll give me the results. I'm not going to go to your house. I mean, we do in the telemedicine program, we go to your house pretty much by the internet. But you're going to bring me a list of blood pressures and we're going to make decisions based upon the blood pressures you've got for the previous week. And it takes time. You know, most of the time we can get people, as I said, 90% of people, we reduce or stop their medications in 7 days, but sometimes it takes a little longer. And you shouldn't really give up being drug-free and normal blood pressure until you've lost all the excess body fat, till you get down to trim body weight. Now, I have to say there are some occasions, I can't really remember when they were, because there weren't very many over my 50 plus years of practicing medicine. There are probably a couple of patients I had to add some of the other medications to in addition to chlorothalidone. But like I say, so few I can't even remember. Well, that's what I think you should know about high blood pressure, and that's the way I'd like to see your doctors treat you. You're welcome to show them my presentation. If you're not getting cooperation because the doctor just doesn't want to learn new things or has a cooperative patient load and doesn't need to have somebody as disruptive as you are, if you want us to care for you, we run a 12-day telemedicine program. And you can be in Ukraine and Shanghai and Sydney, and we don't care where you are, any place in the world. We'll come to you via the internet. And we have people right now from all over the world who are in our 12-day program. And our doctors will do histories and physicals on you. They'll give you, it's Dr. Lim right now that primarily does this. We'll give you advice very similar to what I just shared with you, with the goal of getting you off the medications and getting your health back. And we can do this, big dent in your progress in 12 days in the internet telemedicine program that we're running now. And you can find that on the website, drmcdougall.com. All right, AJ, I enjoyed talking to people about high blood pressure. I hope I got some very difficult points across, but I certainly had a lot of fun sharing with you.
That was wonderful. And like you say, we do have to watch it again. And I took some notes, and it's funny because one of the things I wrote down is one of the most common questions I saw in the chat, which was, you said vegetable fats cause more sludging than animal fats. Why would that be so? And if that's the case, why are so many people still recommending oils, plant oils?
Got me why they're recommending oils. You know that I haven't for 46 years. Why, I don't know. I can give you the studies that show that. Those of you who take our class, you have all those studies available for you based on that. Or if you take the starch certification course, which we give you a certificate that says you have learned the starch solution. And people use this course to run their own private sessions. They develop clientele, they make money, they put up our little plaque that says that you're certified in the starch solution. If you take that class, you get all these studies too. Anyway, that's what the research says. You can read the initial studies. And you say, well, why aren't doctors studying this again? Well, why would you study it again? Show me where the money is. Anyway, vegetable oil causes more severe and more prolonged sludging of the blood. Also, if you want to promote cancer, choose a vegetable oil. Flaxseed oil, safflower oil, corn oil. Much better at promoting cancer growth than animal fat. Yeah, I know, you've been misled. Now, when the oil is in the vegetable, it's perfectly safe. But when you rip it out of the vegetable, you leave all the protein, vitamins, minerals, fibers, phytonutrients behind. All you have is pure oil. You're dealing with a medicine at best and a serious toxin at worst. You should not have oil in your diet. It's not natural. Shouldn't be included. It's disgusting. You won't even drink it. It's so disgusting. If I handed you a glass of olive oil and asked you to drink it, you wouldn't. Or in the process, you'd throw up. It's disgusting.
It's an emetic.
Yeah, I suppose.
No, it is.
Is it really?
Yeah, that's what they say. Like, I've heard from poison control centers that, like, that's what they suggest. If you can't get for the person in the hospital, have them drink oil so they'll throw up.
I learn something new every day, AJ.
Well, thank you.
I'm going to include that in my lecture. Thank you very much.
I'm gonna Google it and verify it, but I have heard that. So we're going to take the questions that were submitted in writing in advance, and then we'll get to the chat. And this one is from DeBellis. How long should a person sit or be still before taking an at-home blood pressure reading?
Well, that would depend on you. You may have to figure this out for your individual self. It may take you a while to calm down. And the circumstances may vary as far as where you came from. Could be a stressful fight with your spouse or your child. And you may never calm down during that particular session. But what I do is I sit in a quiet room, usually in the morning. In the morning, you're going to get the highest blood pressure you'll get all day long. Sit in a quiet room, comfortable temperature, feet on the floor, etc. No coffee. Coffee raises blood pressure. Even decaf coffee raises blood pressure. So maybe it'll take you 5 minutes, maybe 10. But you'll figure it out how long it takes to get yourself settled down. And you should just check the pressure occasionally. If you're not on drugs, I would check it once a year if you're healthy. If you're on medications, maybe once a month, once you get your blood pressure stabilized. If you're in the process of making changes, like you're adding or subtracting drugs, or you're starting a new diet, then at most I would check your blood pressure daily, once a day, not 5 times a day. Once a day is enough information for you and your doctor to have. And you end up occupying too much of your day worrying about your blood pressure. You ruin the time you could be spending with your friends, with your grandchildren. Don't get focused on these medical issues to the point where you ruin your life.
Great, thank you. There's a question about low blood pressure. When is it too low, and is low blood pressure hereditary?
It's too low if you're bleeding to death, got in a car accident and fluids are accumulating throughout your body. Yeah, then it's too low. It is never too low if you're otherwise healthy. And as I mentioned to you, in healthy people, and I use the rural Africans as an example, in the evening, when they're sleeping, sometimes their blood pressure will go down to like 60 or 70 over 40. Perfectly normal. Now, if you're dealing with medications, as I showed you, over-treatment increases your risk of stroke and heart attack because it decreases the perfusion pressures to your tissues. In that case, if you're going to need medication, you don't want to lower the blood pressure below, say, 140 to 150 at the top number, over maybe 80 to 90. the bottom number. If you lower it lower than that, you end up causing more harm than good. That should be enough answer for that person.
Okay. And I'm looking at, so how do you find
Maybe
your
let's come
ideal?
over here.
You had
Pardon?
mentioned that a person, once they achieve their trim body weight, that often their blood pressure will begin to normalize, right?
Well, that's the fun. You know, you could. What I guess the way I wanted to tell the story was, people get well really quickly, and I tell them within 4 months, the arthritis will be stopped, the bowels will be working good. It takes about 4 months at most for the body to heal itself. However, that's not true when it comes to people who are very, very overweight. Being overweight puts a burden on the body. And so on occasion, people have to wait until they hit trim body weight before they can declare themselves successful or declare themselves a failure. And, you know, that extra weight loss at, say, a rate of 10, 15 pounds a month, you're talking about too many people we know that have a year and a half's worth of body fat to lose or more.
Somebody's asking, how does one determine their ideal body weight?
Well, I think a good way to do it is to take off your clothes and look in the mirror. If you're happy about it, that's probably okay. You can also use the Kempner charts. I have those in my November 2016 newsletter, Walter Kempner's charts, where he tells you based on your height what you should weigh fully dressed. Maybe a little scary for some of you. You may think that you'll never attain that body weight, but that's what a trim person weighs. You take a person you take the bones and the muscles and the skin, and you don't have an accumulation of excess body fat. That's what they weigh. And so I would use that chart. But you know, what ideal body weight often lies in the eyes of the beholder. You know, sometimes people praise a few extra pounds as being attractive and desirable. Other times, you know, being as stealth-thin as possible, people admire. You decide. You know, I think trim is better, but the Walter Kempner charts will help. Okay, Mary, why don't you come over here and say hello to these folks?
Okay.
So Mary's here as always. You are kind enough to not only give me an opportunity to do the new lectures I've developed, but also we have a chance at the end of the session to have a practical part of this whole thing. You know, not high intensity, not challenging and threatening like my presentations, but a nice friendly person to come and moderate things for you.
Hi, Mary. Nice to see you.
Hi, AJ.
Hi. Okay. Well, we have still a few more questions that are on this subject. And guys, now you can start asking questions for Mary as well. Noreen says, should people on ACE inhibitors not take NSAIDs and reduce potassium in their diets?
I'd have to look it up, AJ. I mean, it's probably true. There are so many drug interactions. These drugs are so toxic that you know, you really have to be an expert in pharmacology to feel safe about taking them. So I would not be surprised if what she says has some truth that you'd find out when you looked up the prescribing information and the physician's desk reference or on the internet. But, you know, the goal should be to get off ACE inhibitors. That's what this whole lecture was about. You want to have to not worry about the interactions with other drugs and the side effects and so on and the costs. You want to get drug-free. The only way you get drug-free is to be healthy. The only way to be healthy for most of us is to fix the food. And also, you know, drug-free involves getting yourself intermingled with medical people that believe in diet, believe that the drug should be the last thing that you do. Not the first, but the last thing that you do as far as care goes. And that could be a chore for you. Unfortunately, most of my colleagues, and there's some very, very important exceptions, but most of my colleagues are involved in the education they got from the drug companies. And that's what they learned. Yeah, that's what I learned in medical school 50 plus years ago. This will be 50 years. Actually, we're having our 50-year reunion in East Lansing, Michigan this fall.
Wow. How many of you are left?
We had a small class. We started out with 28 people, and 2 of them committed suicide, and maybe 3. And
Hi. Wow.
it's being a medical doctor is a high stress profession, and so you kind of collect people who do things like that to themselves. Anyway, we had at least 3 suicides. We had one guy that was hit by a train, another one hit by a car.
Whoa.
Out of the 28 people, there are probably 20 plus of us left 50 years later. It'd be nice to get together with them. I know the last time I got together with him, I was the honorary speaker for the medical school in East Lansing, Michigan. And I went and met a lot of my fellow students, and they were so complimentary to me, and hopefully they will be this time. They said, you don't look much different than you did when you went to medical school. A little grayer. Of course, I found out Bill Maher dyes his hair. Last night on the Bill Maher show, he talked about dyeing his hair, and I figured, heck, if I ever go back on the road again, I'm going to put some color in this guy. I'm going to look 10 or 15 years younger. I could do that.
That is incredible. 50-year medical school reunion. I hope you'll let us know how that goes.
I look forward to it. We had a lot of fun in medical school with having a small class. We were the first class that graduated from Michigan State University. We're one of the most respected medical schools in the country right now. And I think it was important for me to go to this medical school because it was new, and they thought of themselves as being very progressive. And they weren't like the established medical school, Harvard and Yale, et cetera, where they have a long tradition of everybody standing in line, being proper. I was a rebellious medical student. I almost got thrown out of medical school twice, only because I did what I do now, which is challenge other people to the way they do things. And unfortunately, I challenged the wrong people a couple of times. And
well, that was even before you started talking about food.
yeah, I've been this way for a long time. And anyway, thank goodness for Art Kelly. He saved me twice. Otherwise,
are any of your professors still alive?
I don't know. I really don't know. I know that the head of the medical schools died, and so has Arthur Kelly. And I would guess most of them, because they're probably 10, 20 years older than I am, and they'd be in their 80s and 90s, have died. Maybe not. Maybe there are a few around. I don't think the alcoholics made it. A few of those.
Wow. All right. So here's a question from Ellen. She says she took your 10-day program in 2013 and has eaten your way oil-free since then. And she wants to know, is it possible that anxiety can push up a person's blood pressure?
Yes. Yeah, but that was the first drawing that I showed you, and that is with excitement or pain or anxiety. Yes, your blood pressure will go up. It's called white coat syndrome, and that's why you don't value the blood pressures when you go into a doctor's office, because what you're doing is you're measuring how frightened the physician and the circumstances make you. That's why you check your blood pressure at home. So yeah, I can very well. And there are ways of getting around that may help. They have 24-hour monitors. And these days with your iPhone, I mean, they're very simple to use. And what these instrumentations do is they measure your blood pressure, say every few minutes or every hour, and then they record the values, and you can see what happened over a whole day. So it's called ambulatory blood pressure monitoring, and you may want to do that. But then again, you just might want to eat good, walk around, get a little sunshine, and get well.
Do you have to wear something for that?
You do, yeah.
Oh.
Wear a little cuff. They have even more invasive ways of doing it, but I'm not familiar with them, so I wouldn't talk about them.
Okay, so this question from Leslie leads me to believe she would be the perfect candidate for your next virtual McDougall program. She says, I was just put on rovastatin and losartan. I was plant-based for many years, and my cardiologist said it isn't working with my family history. I was 160 over 78. Cholesterol was 189 with the statin. She put me on drugs and wants me to eat fish. My cardiac risk score is off the charts at 600. How can I control my health?
Well, it's not the way I take care of my patients. First of all, I believe that my patients are healthy people. I also believe that they're intelligent and they like themselves. Most of the medical profession thinks people, our customers, are stupid. They're barely smart enough to take the pills we prescribe for them. They're barely smart enough to sign the check at the end of the office visit. That's the way we're taught to think about our customers. So if that's how the doctor's thinking about you and it sounds like he or she is, that's not the way you want to be supervised and helped. You want to be helped by somebody who looks at you as a healthy person. You're just doing something wrong. Now, I wouldn't treat a blood pressure, cholesterol 180 some with statin drugs unless there was something else going on. And I certainly wouldn't use losartan, which is an angiotensin receptor blocker, to treat blood pressure. Anyway, yeah, like you say, she'd be ideal for the 12-day program we run now. And we do everything we could to get her off the medication during that 12 days, but we follow up with people for an entire year as part of the program. So what we weren't able to accomplish in 12 days, we've got 12 months to work with you and to get these things accomplished. We just need willing people is what we need. If you're interested in being well, if you're interested in getting out of the medical business, you're interested in getting off the drugs because there's side effects and costs, we're the right people for you. That's our whole goal. Is to, you're a healthy person. You're just not expressing it. We're going to help you express your good health.
What do you think about the statement from the cardiologist that a plant-based diet doesn't work with your family history?
Again, ignorance is profound in the medical profession. He knows nothing about diet. I know he knows nothing about diet because it's not taught in medical schools. They teach you biochemical formulas. They don't teach diet therapy. You may recall, I've talked about this many times, and I won't discuss it in any detail again, but in the year 2011, in the state of California, I wrote a law and got it passed. It was called SB 380. You can look it up. SB 380 would force doctors to learn about what human beings eat. That's all. I presented the information to the Senate committee in early part of 2011. It was voted on by both houses and passed unanimously. And it was signed into law by Jerry Brown, our governor, in September of 2011. But the Medical Board of California found ways to get around it. I don't want to go through that misery. I just worked too hard to even bring up the topic. But your doctor knows nothing about diet therapy. So, just because he or she has a degree in whatever doesn't mean that they're educated properly. And think about it, there are populations of people who had no heart disease prior to World War II, no breast cancer prior to World War II. We within our memory, we have people in the millions that didn't become obese, who didn't take all these drugs, who are hardworking, fighting people who lived on starch-based diets, like rice. So, if a whole population of 1 billion people can avoid high cholesterol and high blood pressure, then I certainly think the statement that your family history sets you up to be a failure is wrong, profoundly wrong. It may be a little more difficult for you because your family tendencies, but it's not your genetics. It's what you eat.
Yep. Thank you. Pat says, Dr. McDougall, is there a way to get the reference about what minimum measurements should be treated for seniors and to what blood pressure measurement?
Well, you could replay this video I just did. I'm pretty careful about putting the scientific references on the slides. And when we talk about the U or J-shaped curve of mortality, I gave you 2 examples. I gave you at least 5 scientific references on these slides. And you can just go to Google, you put in the reference, and almost always the reference comes up and it's accessible for you. It's open access. And you can read the whole paper. Or you could just start with your original research. You could put in U-shape or J-shape curve of mortality and high blood pressure. And dozens of articles will be spit back at you, which all show the same thing. Oh, except for the ones where the spin doctors from the drug companies got involved. No, they discredit all this science so they can sell the drugs. You know, if the idea that more drugs are bad, well, that's how they make money, selling more drugs. What do you think they're going to do? Just business. Nobody hates you. It's not a conspiracy. They just want the money. Anyway, this is not a controversial topic, U-shape or J-shape curve of mortality. Something I've known about for over 30 years. And the references I gave you are all within the last couple of years.
Great.
That makes sense, doesn't it? You know, the pressure goes up because the system is all clogged up and you're trying to deliver nutrients to the vital organs. And you introduce a drug which decreases perfusion pressure. What would you expect to happen?
Thank you. This is a question from John, and he wants to know if eating natural sweets like dates or eating too many would have any effect on blood pressure.
Just good effects. In other words, you'd be getting calories that don't have the artery damaging properties like saturated fat and cholesterol. You'd be eating food that has dietary fiber and carbohydrates, which are kind to the arteries. So I can think of nothing but positive things that would happen. Now, dates are very high calorie, and calories count. So if you're trying to lose weight, you don't want to put dates as a dominant part of your diet. That's a lot of sugar, a lot of calories. And you'll have to go back and review the lecture I gave on obesity to understand that the body does not convert sugar into fat with any efficiency. But if you're going to eat sugar, the body's going to leave your body fat where it is. It's not going to burn it because it prefers to burn sugar. It's called glycolysis. You learned about it in high school biology. The cells burn sugar. When I say sugar, you know, I mean potatoes and sweet potatoes and rice and corn. But, you know, table sugar has been given a bad rap. It's not health food. Rots your teeth, raises triglycerides, it's empty calories, it spares the fat that's on your body, and so you don't lose weight as easily. It's not health food, but it's not the demon that it's been played out to be. And the reason you're not getting well is you're following false gods, bad information based upon beliefs, not science, based upon, you know, wishes. I want to hear good news about my bad habits. So I happen to like pork chops. So I'm going to get all the research I can find that says eating pork chops is good for me. Yeah, it's human nature. But I teach and do the things that I do, and I have for the past nearly half a century because my patients get good results. I'm the luckiest doctor in the world. I don't have to offer bags full of pills and dozens of excuses to you as to why you're sick. I can help you get well. Can you imagine how good that makes me feel? I mean, think about it. Think about how happy I am as a doctor because my efforts result in helping other people.
Yep. Thank you. So this is from Dawn. I've had 3 heart cath ablations and now have some flutter. I'm on Lisinopril and
Lisinopril, that's an ACE inhibitor.
and Sotal, which is an antiarrhythmic med, because I also have tachycardia. It's very short, but I have it a couple times a day for several seconds. I did lose 40 pounds, went plant-based, but still had tachycardia on Lisinopril 10 milligrams.
Right. Well, you know, he's in a desperate situation, and hopefully the drugs will help him not have the arrhythmias. And the conditioning he is likely talking about is called atrial fibrillation. quite a common condition. It's due to eating the Western diet. What happens, you eat the Western diet and you plug up the tiny blood vessels in the heart, the blood vessels that supply the nervous system of the heart. And as a result, you develop this arrhythmia where the atrium beats 300 times a minute. It's called atrial fibrillation. And when you get into that kind of illness, sometimes you're left with problems because it's not reversible. And you can eat potatoes until they're coming out of your ears, and you're not going to reverse the condition of atrial fibrillation. The damage is done. So if you're continuing to have arrhythmias, you should take antiarrhythmic drugs with hope that they'll make you more comfortable. But often these antiarrhythmic drugs, they increase your risk of dying. So you need to explore that also. How troublesome are the arrhythmias? So troublesome that I would take a drug that increases my risk of dying. And you need that information. You can sort it out. You have a computer. The internet is powerful. Look it up.
So atrial fibrillation wouldn't kill you?
No.
It's just uncomfortable feeling.
Right. Your dad had AFib? My mother had
Your
AFib.
mother did, yeah.
She had it for 20 years. The heart function is decreased by about 25% when the atrium isn't beaten in synchrony with the ventricles. So you get a reduction in heart function by about 25%, which is not a big deal unless you're trying to run a race. So you're perfectly fine. The next thing you have to deal with is that people who have atrial fibrillation are more likely to form blood clots in the atrium because it's fluttering like a bag of worms, and the blood doesn't flow out of it very easily. And so particularly when you're on the Western diet, you form blood clots which embolize to the brain. And it results in stroke. About 3% of people a year who have atrial fib develop some type of cerebral vascular accident. So you're treated with blood thinning drugs. It used to be Coumadin, and now it's Eliquis or other blood thinning modern medications you're treated with. And that reduces the risk of these clots going to the brain. This is proper standard medicine. Do I use it? Yeah, a little bit, but I use it carefully. I only give people who are going to benefit this kind of therapy, and healthy people don't benefit. At least when we weigh the harms and risks for the benefits, you find out that healthy people, they don't need it. So my patients with atrial fibrillation are generally healthy. And so they don't fit the standard criteria, which you can look up. You look it up, it's called the CHADS, CHADS. CHADS, the CHADS chart that helps you figure out whether you would benefit from taking these blood thinners or not. And I have to say, by reflex, almost all doctors that I've come in contact with, they put people on blood thinning drugs if they have atrial fib. They don't bother looking at the research that determines whether or not you'll receive more benefit than harm. And you can look that up yourself. It's called the CHADS score. CHADS.
Great. This question can be answered by both of you. Nutritional yeast, good or bad?
Well, it's good because it adds flavor, and you can add it to popcorn because it's sort of a flake, so it will stick to the dry popcorn. I use it to add flavor, more like a cheesy flavor to things. So I think it's good.
Do you have a favorite brand?
I have Bragg's in my cupboard right now that I like.
Do you like the taste of it, Dr. McDougall?
I just eat the food. I don't ask her what's in it.
Yeah, but there's a few things I remember you don't like
eggplant.
quinoa.
I don't like eggplant.
Yeah, that's right.
He eats things that I put nutritional yeast into, so I guess he likes it okay.
Yeah.
Great.
I don't use a lot of it, but I almost always have a jar of it in my cupboard.
Yeah, nice. Dana asks, what is the most accurate blood pressure monitor or device for one to use at home?
I couldn't tell you that. You can go to the internet and you can look up reviews of blood pressure cuffs, automatic blood pressure machines. You could see what I did as I looked up, I went to Amazon and I looked at various machines that were sold on Amazon. Generally, they carry some pretty good products. Amazon does. And the cost of these machines, these automatic monitors, which you can use easily at home, are quite accurate. The wrist ones are not very accurate, so you want to get a cuff that fits around the top of the arm. Costs between $25 and $75. Now, you know, I have lived my life with a philosophy, and that is a good whiskey is determined by the price you charge for it, because it all tastes the same. So I often buy things with that idea. I can't figure out which is the best. And even though I've looked at the reviews, I usually pick the one that costs more.
Yeah, that's very true.
Yeah, assuming that the price reflects the quality. I realize this is not always the case, but what else am I going to use?
Great, thank you. I just saw a question here. Where did it go?
I would also add to that when you're looking up the reviews, find one that people review as easy to use, easy to put on your arm. And actually you have to send them, they'll tell you when you get it, you have to send them back every year or two to have them professionally calibrated to make sure they're measuring accurately.
Thank you. Steve says, can medications, for example, the pills I take for toenail fungus, slowly and surely cause high blood pressure?
Not that I'm aware of, but then again, there are lots of things that I don't know. You might want to look that up on the internet. I can't think of any connection now between toenail fungus medicine and blood pressure.
Okay, thank you. This is from Gary. Does Dr. McDougall have any thoughts about alpha blockers for hypertension?
Yeah, they're not used. Alpha adrenergic blockers, that's another class. They're not used very commonly. And they're used often to treat prostatism because what they're like is called Flomax is one of them. What the most commonly is prescribed for is men who have difficulty urinating. And you take the alpha adrenergic blockers and somehow that relaxes the muscles around your urethra and allows the passage of urine a little easier, but it's not used as a blood pressure medication very often. The only blood pressure medication that has been thoroughly tested to reduce your risk of heart failure and strokes is chlorothalidone. The rest of them lower blood pressure, but as far as other outcomes go, you know, the testing of them has been very sparse. And whether or not a medication gets approved to be sold as an antihypertensive depends upon whether it lowers blood pressure or not. Even if it may increase your risk of dying like it does in angiotensin receptor blockers. Even though it increases your risk of dying of heart disease by 60%, they don't care. It still lowers blood pressure. And so it's sold to you and your doctors as an antihypertensive medication. Well, good grief, the reason you're concerned about your blood pressure is you don't want to die of heart disease. Why would you take a drug that increases your risk of dying of heart disease? Makes no sense. And that's why I explained to you, there are two classes of drugs I don't use, ever. And I almost always can get away with just a little bit of chlorothalidone. I don't have to even bother with the other medications. But when you're on chlorothalidone, any diuretic, you don't have to be concerned about the loss of potassium. But otherwise, they're relatively safe. Powerful too. Chlorothalidone is much more powerful than hydrochlorothiazide. And as I mentioned, if you want to look at the endpoints that you really are concerned about, like strokes and congestive heart failure, then you find that chlorothalidone wins out every time over hydrochlorothiazide.
That's a generic drug, right?
Yeah, it is. It costs like, you get 90 pills at Walmart for $10.
Great.
If you wonder why it's not used, well, we don't have any pretty young ladies coming into the office with donuts and pizza for our office staff. And of course, the male doctors, they don't mind a little entertainment by having a scantily dressed high school ex-cheerleader come in and entertain them for an hour or two. Well, she's there to sell the most expensive drugs that this company makes, not the cheap ones they make no profit off of. Why do you think you get the prescriptions that you get? It's not because it's in your best interest. It's what is currently being sold through all kinds of high pressure techniques to your doctor by the drug companies. They pay for dinners, they pay for theater tickets. And they send these beautiful young women in to see you. I still remember that. Even at 75 years old, I still remember, Mary.
You never got any after a long time.
Yeah, they stopped sending me their entertainment after a while. They figured out I don't write drugs. And so it was only in my very early years when I had that kind of entertainment. And I was fortunate to be married to somebody that could well entertain me. I didn't have to have any artificial entertainment.
Great. Mary asks, in your book, The Healthiest Diet on the Planet, there's at least one recipe that contains sesame oil. Does that mean sesame oil is okay?
Sesame oil is the only time I use sesame oil is a little drip at a time for seasoning. I don't use a big glob of it to saute anything in. It's just for flavor. So it can easily be left out, but it's not, if you notice, even in the recipe, I don't tell you to saute the vegetables in sesame oil. I tell you to add a little drop at the end for flavor.
Great, thanks. TS asks, I noticed a new class on your website titled Maximum Weight Loss Class. It's not the certification class. Can you discuss what that class teaches?
You know, I wish I could give you a complete explanation of it, but we just started teaching it. It's abbreviated in the terms of time and cost. And it's focused on weight loss. And there are a couple lectures that I give. There's a lot of support from our team, but I believe it does not include medical care. And it's a way to get to more people inexpensively, very effective teaching tool. But I'm not familiar enough with it to tell you anything more than that. But if you had Heather on, you know, our daughter who runs and owns the company, she could give you a thorough explanation as to what they're doing. They're trying to, I've always been focused on just taking care of my patients. And so I've always tried to just develop a medical setting. And Heather, she has a much broader outlook on what this business ought to be. And so she's interested in helping all kinds of people at all different levels of health and interest and financial opportunities. And you know, she's really expanded the business. And it really has. I have to tell you, AJ, I was impressed a couple of days ago. I don't do this very often, but I put my name into the internet and whoa, and we have a lot of exposure. And that's as a result of me retiring and Heather taking over the business. And, you know, the young people, they know how to work the internet. They know how to work devices and social media. And, you know, you can't teach me that stuff. So fortunately, she's added so much to the business. And she's relatively old, too. She's almost 50.
Wow.
Yeah, but she knows how to run the Instagram.
That's
And there's a lot of information on the McDougall program on Instagram. And you could probably go there and ask just a question. Or they have places where you can ask a question or make a comment and ask what, you know, if anyone's taken the maximum weight loss course and what it involves, and you get an answer from the people on Instagram that run our Instagram page.
well, Heather is booked on the show on the 26th of this month.
All right, there you go.
So she'll be able to answer those questions. Peter says, how do you feel about polishing a pan dry with a minuscule amount of oil to help the pancakes not stick? There are non-stick pancake griddles, by the way.
There are. And you know, what I found is that the best ones are ones that have not been seasoned with oil. Once you start putting oil onto the texture of a nonstick pan, it just ruins the nonstick ability. So if you start by what they used to call seasoning the pan with some oil and then wiping it out, it eventually over time, it ruins the nonstick function of the pan, so it doesn't work as well. So I don't use it. I don't recommend it.
Right.
I just buy good nonstick cookware. And there's a lot of them out there.
Yep. Dr. McDougall, there's a lot of questions on colonoscopies and bloating. Maybe the next time you come back, you could do some GI stuff.
Well, I could do the GI, or there's a lecture on screening, early detection that I'd like to give this group sometime. It's about mammograms and colonoscopies and, what screening techniques should you avail yourself to? Because this is a big racket. This is the ultimate in disease mongering. Disease mongering is turning people into patients, which is what any good business would do. I mean, we're just doing business, folks. So what you do is you get people frightened. You tell them if you join your screening program, we'll find the disease early enough to make a difference. True or not, they've captured you. So maybe I'll do a lecture sometime soon on screening and what's worth your while and what's not. I recommend 2 screenings, only 2, and they are Pap smears for sexually active women, done every 3 to 5 years until they're 50. And I recommend colon exams using either stools, you can check the Cologuard with the genetic material or just for blood, or you can have 1 sigmoid exam at age 60. I recommend against colonoscopies, too dangerous.
What about the virtual? Don't they have a virtual colonoscopy?
They did. That's where you take an X-ray, and then you're exposed to as much as 10,000 chest X-rays. I think the stool is a good way to go. It costs for the complete testing somewhere between $3 and $40 it costs. A sigmoid exam, which is done in the doctor's office without anesthesia, is about $200. Relatively painless, virtually no adverse effects, no risks, as opposed to a colonoscopy, which is done in a surgical center or a hospital under sedation or anesthesia with a lot of risks at $3,000 an exam. I just to entice you about the lecture on early detection is what I want you to consider is that you are risking your life today. Okay, you have a colonoscopy, you're risking your life today by the theoretical benefit that you're going to have less risk of dying of colon cancer 10, 20, or 30 years from now. Do you want to take that bet? I certainly don't recommend it. Anyway, for those of you who can't wait, there are two lectures on 2 papers I've written on colonoscopy on the website. You can look it up. One is August 2010. The other I wrote in 2017. And they go into all the details about colonoscopy. Yeah, interesting. When I published the one in 2010, I was working with a lot of gastroenterologists. And I actually gave their responses in the next newsletter about what they thought about my August 2010 article on colonoscopies. A gold standard to refuse is what it was called. And so I encouraged gastroenterologists to respond back to me and tell me why I was wrong. And you can read their responses in the next month's newsletter. Didn't have much to say. Certainly not enough to say that would discourage from the Canadian Task Force on Preventive Medicine telling Canadian citizens that they should not get a colonoscopy done as of 2016. All European countries that I'm aware of do not recommend colonoscopies for their citizens. It's only the US and a few other countries that do, and it's based on making money.
Well, there's a lot of tests that are for early detection, so maybe you should do a whole talk on that.
I will. I'll do that. Maybe I'll do that next time. I don't know. Keep you guessing. Depends on. I don't know. It depends on what you folks would like to hear about. You can always write me at drmcdougall@drmcdougall.com and tell me what you're thinking. And that would be easier for me to put together a presentation knowing that you'd be interested in the subject. There are a few other things I have to talk about, but boy, have I covered a large amount of information thanks to you, AJ. A whole lecture on breast cancer, a whole lecture on how diet affects hormones and precocious puberty and menopause, a whole lecture on heart disease, one on autoimmune diseases. And we talked about that a couple of days ago because Will Smith's wife has an autoimmune disease called alopecia. And Will Smith made it a illness heard around the world when he slapped Chris Rock at the Oscars. You know that. I mean, that's all everybody's talking about. So what we did is we put out that lecture that we did on Chef AJ's show on what causes autoimmune diseases. And it got like 65,000 hits right after the mailing went out. And so I try and do things that are timely and relevant to you, and also do them with the idea that when you come to see us at our 12-day internet program, which we encourage pretty much everybody to do. I mean, it's an amazing 12-day experience for a relatively inexpensive price. I want to make sure you walk away with all the education you need. So I put these lectures together, and if you come with breast cancer, I'm going to have you sit down and watch the breast cancer lecture. You got diabetes, you spend an hour with the diabetes lecture. You got autoimmune diseases like rheumatoid arthritis, ulcerative colitis, Crohn's disease. You sit down for that hour. And now with the high blood pressure, if you have high blood pressure, which a good 20 to 40% of people have, you sit down, watch this. Yeah, watch this lecture that I had the opportunity to give. And again, I appreciate the audience, and it's much better than for me to give the lecture and knowing you're watching and listening and developing questions rather than just talking to the computer.
I know what you mean. It is hard. It's harder when nobody's there looking.
Well, yeah, yes, it is. And I certainly remember the days when I used to do a live audience presentation, and that was just completely different. And I would look forward to doing that again. That's a lot of personal positive feedback. And of course, you see the late night talk show hosts so glad that they finally have an audience back and they can really perform now, whereas it's hard for an educator or an entertainer to work to blank walls.
I agree. So Sandy says, my husband has SCAD, spontaneous coronary artery dissection. He had his heart attack last year. He takes metoprolol. Can he ever get off the medication? The cardiologist says never.
Well, as I say, once you're on these drugs, the drug companies have taught us that you never get off. It's a beta blocker that he's on. And the idea being that he has the dissection of the artery caused by pressure. Not so. The dissection occurred because the arteries became diseased because of the way he's eaten for so many years. The pressure had little or nothing to do with it. If you go back and review what I shared with you, you will raise the pressure to 3,000 millimeters of mercury before you cause any rupture in the arteries. I've given you the data. I've showed you the study. So it's not the pressure, and that's why he's going to get very little benefit from being on a beta blocker, which reduces the pressure. If you want to keep the arteries from failing, you must fix the problem. It's the food. Atherosclerosis is reversible. The arteries will heal. In fact, they're trying to heal right now. For all of you, all of us, your body's trying to heal. It's constantly trying to heal. It's just that the damage outstrips the ability of the body to heal. Get control of the fork and spoon, and you'll see the healing going on. So if I was taking care of your husband, I would likely put him on a very strict diet. Shouldn't surprise you. I'd keep him on the beta blocker because I'd get less criticism than taking him off. That's probably why I would. And I would probably give him some statin drugs too, because he's already declared the fact that that it's a diet, and even though the studies on using statin drugs to prevent heart attacks show very weak benefits. In fact, so weak that you can't see the benefit in people who haven't had previous heart attacks. You can only see the benefits of using statin drugs in people who have already had a heart attack or a stroke. You got to look at really sick people because the benefits from these drugs are so tiny. You can't see it in healthy people. You have to look at sick people. And the benefits are really, really tiny. The drugs, the benefits are very tiny. But, they're reasonable. And besides that, I don't want to be criticized by my colleagues. And certainly I don't want to go to a malpractice lawsuit. So I'm going to protect myself a little bit, but I'm certainly not going to protect myself to the point where I allow one of my patients to be harmed. If I thought the beta blocker was doing the patient harm, I would take them off it for sure. I just don't think it's doing any good. It's not the problem. The problem's not the blood pressure. If you haven't understood what I believe, then you spend another 45 minutes listening to the lecture I just gave. You know, I think I did a pretty thorough, pretty good job. And I think I conveyed to you what the problems are and what the solutions are. So you got the lecture, it's free. You can watch it 1,000 times. You can show it to your doctor. You know, take the lectures I've done, the books that I've written, the articles I've written, show them to your physician and say, this is the way I want to be treated. Tell me why this is wrong. Tell me why you're not treating me this way. I mean, if you like what we do, then, you know, instead of coming to us, why don't you get that kind of care from your physician? I'll tell you why you don't do it. Because you're not going to get the care. What the doctor's going to say is, oh, that's interesting. Next. And 7 minutes later walks in another customer who doesn't put up a stink and doesn't ask all these questions. You just shove the money in your pocket and in the bank. That's what we do. Just like every other person on this earth. It's money.
Yep. Okay. Here, I got a question. I got a couple more. But where did it go? Oh, this is from Johnny. Does Dr. McDougall have any recommendations concerning nitric oxide?
Colin Campbell talks a lot about nitrous oxide and how it helps the arteries stay healthy. You know, for me, I don't need to know this detail. You know, I know that the foods that I recommend you eat result in high nitrous oxide levels in your arteries and make your arteries most healthy. Now,
how would you measure that?
I don't know. They probably have some kind of tests.
Oh, okay.
I don't really know.
I think there's some sticks. You know, I actually had Dr. Nathan Bryan on last week, who's supposedly the world's leading expert on that. And there's some test sticks you can test.
Okay.
Well, it's become popular. I'm sorry, Mary. I don't know. But I could look it up. I mean, I could look it up on the internet. So anyway, I know what you should be doing to fix the problems. You need to change the food to a starch-based diet with fruits and vegetables. And get off the drugs and get a little sunshine and go for a walk. I know that's what you need to do. I don't need the details. Some of you do, and some of you learn the details because it's a way of selling your products. Selling you supplements that raise nitrous oxide levels. You don't want to do that. You want to do it with food.
Yep. Are routine dental x-rays okay?
Oh, now you're getting really outside my field. I'm a medical doctor, not a dental doctor. But if you want to know what I do, I don't get routine dental x-rays. Nobody in my family does. Why? Well, I'm afraid they're going to find something. And the x-ray machine is the biggest draw to medical practice that's ever been invented. In other words, you're disease mongering. You're turning people into patients with this x-ray machine. They always find something, don't they? A little cavity over here, a little something over there. All right. Well, you know, you've got to show that all this investigation results in a better life. And I don't think that's the case. If you have a bad cavity, it'll hurt. It'll be obvious. You don't need to be poking around with x-rays. I realize there are some exceptions to what I had to say, but in general, I think that the x-ray machines in most dental offices are a way to really make profits. That's what I think.
Okay, great. Is popcorn okay?
Yeah, if you don't put oil and butter on it. If you just put air popcorn. And then, like I said, you can put some nutritional yeast on it. Or when my boys were little, they used to spray Bragg's liquid aminos on it very lightly, make it a little salty flavor, and it's great.
Good. Okay, here's Mary says, what does Dr. McDougall think about getting ALA fatty acid instead of DHA EPA fatty acid? Should we go to seaweed to get the DHA EPA, or is ALA good enough? People always are worried about this omega thing and fish oil and
Right. Well, the reason is because a lot of people out there selling fish oil supplements. Your essential amino acid is alpha-linolenic acid, alpha-linoleic acid. That's made by plants. Only plants make that. There's also a linoleic acid, which is made by plants too. Linolenic acid. Pardon me, I'm getting the words a little confused. Anyway, the original source of DHA and EPA, in other words, icosapentaenoic acid, the original source is plants. No animal, no fish can make omega-3 fats. We don't have the enzymes that allow us to desaturate at the carbon-3 position. Only plants can do that. So the original source of all essential fatty acids is plants. And if you eat enough plants, which you're going to be able to do, you're going to make all the EPA and all the DHA you need. And I've looked into the arguments that try and convince people they need to add fish to their diet, because the human being is not able to make as much DHA as they need from essential fats that are made by plants. That's not true. It's not true. The research says it's not true. I actually wrote that research in the Starch Solution book, but you can investigate it. You can look up on the internet the various studies, and you could use the things that I've written as a place to start, to read the references. But if it were true, you had to have fish fat to have a healthy brain, et cetera, then there'd be nobody living away from the water. Populations that existed that didn't have a source of seafood wouldn't exist. Terrestrial populations would not exist. So obviously they do. In fact, probably most of the people that ever lived on Earth didn't live seaside. They weren't fishermen. They didn't eat fish. And boy, oh boy, they seem to do okay. Anyway, it's made by plants. Plants make all the essential fats. They make all the essential amino acids. They make vitamins. 11 of the 13 known vitamins are made by plants. It's a conspiracy. Plants are trying to work their way in your life. Yeah, come on, you guys.
Okay, thank you. Is chlorothiazide a prescribed medication or
Yes.
over the counter?
No, you have to get it by your doctor's prescription. And likely your doctor will hesitate. Shouldn't, especially if you present some research that says this is how you'd like to be treated. Or you can show the doctor the presentation I just gave. Doctor can look up the papers himself, because I put the references there for you on the slides. No, it's a doctor prescribed. Doctors are not used to prescribing chlorothalidone. This came out in the late 1950s, and quickly it was replaced by a brand name drug called hydrochlorothiazide. And as the new drugs came out, the brand name, the high profit, the older drugs were relegated to the past. Doctors were discouraged. They were actively discouraged from prescribing these generic medications. They have spin doctors that work for the drug companies that take and publish papers, quote, scientific, which degrade the past treatments and encourage the doctor to prescribe the brand new, top of the line, high-tech pill that we sell. Instead of like 90 pills for $10, we sell $90 a pill. It's just business. Get over it. Nobody's out to get you. It's just they're trying to make money. Sound like something you know about in your business?
Yep. Okay, this is from Kama. I am following your program and not losing weight as fast as suggested. I've lost 45 pounds since last May.
Well, you tell them why they haven't been losing the weight as fast as they'd like, JJ, you know.
Well, you once told me that one of your mentors, Dr. Walter Kempner, said all dieters are liars.
I did say that. I did, but I thought you had.
He said that too.
Well, I would just say that it really comes down to calorie density. And so is this person eating out? Because then you're getting oil, whether you know it or not. And, sometimes you just got to tweak that starch to veggie ratio just a little tiny bit, just a little bit. Never skimp on starch, but just
stay away from the nuts and avocados and coconut and things like that. High fat plant foods.
I think that what you mentioned, AJ, that those are the things that you have to stop eating out. You have to do what we tell you to do. And nuts and seeds and avocados and fake foods are often the downfalls of people who eat vegetarian diets. I mean, think about it for a minute. Prior to 1980, there were 2 billion Asians. China, Japan, Thailand, Vietnam. Nobody was overweight. The effects of a healthy diet are so profound that you can't escape what I just told you. The only overweight people I can think of in Asian countries would be the sumo wrestlers in Japan. They eat a special diet full of fat. Anyway, it always works. Okay. None of you get calories from the air or from water. It just doesn't happen. The law of thermodynamics says that if you're going to change the weight, you have to change the ratio of calories in versus calories out. And some calories are particularly fattening. Those are the fats and oils because they're so efficiently stored. The fat you eat's the fat you wear. Carbohydrate calories, not very efficiently stored because it takes a lot of work to change a sugar into a fat. The body doesn't want to do that. So it burns extra carbohydrate off as heat. I think that was the last set of lectures we did was on obesity, wasn't it, AJ?
Yep.
Yeah, they're all there. Take an hour to go through that whole thing. I showed you skinny people. I did a whole video for you in that lecture on skinny people. And I showed you populations that probably amount to 2 or 3 billion people. And nobody is overweight.
You want to hear something interesting?
Mm.
So to me, restaurants are a punishment. And luckily the pandemic, I haven't had to eat in one. And even before that, I maybe ate at a restaurant once a year where there's a gun to my head. But I learned that, how sometimes restaurants have their nutritional information available online, or if you ask for it, well, they'll put the number of calories in, you know what I'm talking about, right? Well, they don't have to say how much oil. So in other words, let's say they have a stir fry on the menu. They don't have to put in that the amount of oil they're using to cook it. They only put the amount of calories and fat in the ingredients in the recipe, not in the oil. So that means whatever you're thinking, it's going to be way more oil and way more fat because restaurants really don't know how to not use oil.
No, they sure don't.
No, they sure don't.
In culinary school, they never teach future chefs how to bake or cook or anything without oil or some kind of fat. And
I can attest to that. Boy, we so much coconut oil and agave. It was just like, oh my God. It's like, that's crazy, isn't it? Okay.
So since we got together last time, we had an experience at eating out. We went to Hood River with our son and his family. And there was a Japanese restaurant in Hood River, we're talking about Oregon. A Japanese restaurant we used to be able to order without any trouble at all, as we can in almost every Japanese restaurant. Very oil-free food. Well, it changed the ownership since the last time we were there, and it became a noodle place. And even though we asked them to cook it without oil, for the 6 of us, it cost me $170 for a pile of grease I wouldn't eat. I felt cheap, $170 for grease. I'll never go back there again. Eating out is a terrible experience.
I agree. I think it's terrible. Steve wants to know if Medicare will, or do you foresee a time where they might pay for any part of your 12-day program?
Yeah, they could, and they would if we applied for it right now, because we have research that backs up our program. The Ornish program, they are involved with Medicare, and so is the Pritikin program in California. If you want to go through a program that takes advantage of government intervention, because they do, then I would say go to the Ornish program. You get really good care. But I don't want to be involved with the government in terms of our relationship. And we charge a reasonable enough price that I don't need to have Medicare substitutions or help for you to come and learn. In fact, we take it another step further, and that is if you go to the website, drmcdougall.com, you'll find the entire program there for free. If you are willing to take the trouble to do it, it's all laid out in 62 pages of discussion, free. There are probably 2,000 recipes available for you for free. So you want to do one better than worrying about whether or not Medicare is going to help pay for you to come to our program? Well, you got the Ornish program, which I would not discourage you from going to. And you have our website, which is, I think, a pretty good deal. But most people need a little extra help, and medical care is really important, especially when you're dealing with somebody on medication. You need some help getting off these drugs. And
well, wasn't there something about the health savings program that you could apply for part of the cost if you have a health savings?
Yeah.
HS.
I don't know whether we take it or not, but yeah, there are
there was something like that. I remember it used to be on our old website.
Oh yeah. We did have something up there. Yeah, but you'll have to look into it. It's not part of our business.
Okay, great. Thank you. Where did it go? I just saw a question. Well, people are saying, when you had mentioned not to have a colonoscopy, but what if you have a history of polyps?
Well, then you ought to change what's causing the polyps, which is the food. The food is irritating to the mucosa of the colon. It causes the mucosal cells to proliferate because of the irritation. Just like if you keep scratching your hand, the skin cells, they'll make keratin. They'll proliferate and make keratin. If you scratch mucous membranes, what happens is they proliferate into lumps that are called polyps. Polyps only exist in populations that eat the Western diet. Somewhere around 30 to 40% of people who don't know they have polyps who eat the Western diet. But it's non-existent. There's evidence that says that if you stop eating the irritating foods, the polyps will disappear. I'll go into that evidence if you want, but it's pretty darn convincing. So I would certainly fix the problem. As far as repeat colonoscopies, if you've had polyps, doctors generally recommend you go back and have a repeat colon exam every 5 to 10 years if they find polyps. They have no evidence to support this recommendation. It's just their hunch. There's no evidence that says if you don't follow up, you'll have a higher risk of dying even of colon cancer compared to those who get repeat examination. There's no research done to show that.
So, but don't they remove the polyps when they're doing a colonoscopy?
They're supposed to, but they miss a lot of them. 42% of the time they miss them.
But they can also remove them if you have a sigmoid, right?
Yeah, and the polyps that kill are the ones in the left side of the colon, which are within reach of the sigmoid. The polyps that are present on the right side of the colon, the distal colon, when they're removed by a colonoscope, they don't see a survival advantage. August 2010 McDougall newsletter, you'll have all this discussed for you. So yeah, and if you have polyps, you should have them removed because they are precancerous. But the fundamental thing you ought to do is start bathing your colon tissues with healthy material. And then, I do recommend colon cancer screening. You heard me say so. But I think you should be looking in a relatively inexpensive, relatively non-hazardous way, which is to check your stool for blood. And maybe a Cologuard test for $600 they cost. And then, which you're going to clear a whole bunch of the population of people, so they don't have to go any further. But those of you who have positive stool tests, then you'll have to go on and have a more invasive technique, such as a sigmoid. Most likely you'll get a colonoscopy. Yeah.
Great. Here's a good general question. It's about, it's from Dana. Who would I contact to discuss if I'm an ideal candidate for your 12-day program?
Well, you know, what we do is this is, again, this is an invention of Heather's. Since I gave up controlling the business, I still get to supervise. I still get to offer some, what we do is we allow an initial examination. So if you have any question about whether or not you're a candidate for the program, for a fee, which is refundable if you decide to take the program, Dr. Lim will spend an adequate amount of time with you, go over your history, your physical, and tell you whether or not the program is of advantage to you and what we'll do for you. And if you decide not to go to the program, then you're charged for his time. You know, standard medical charges, nothing exorbitant. If you decide to go to the program after Dr. Lim's evaluation, then that will be included in your fee for the entire program. We just work that in because everybody who goes to our program spends time with Dr. Lim. And, you know, some of the people spend time with me, but everybody spends time with Dr. Lim. And so if you want to know for you know, a minuscule amount of money compared to what you're looking at in terms of treatments, if you want to know for $250, that's what the cost of the visit is, I believe. You could have it corrected by Heather, but you can spend some time with Dr. Lim and find out exactly.
It's not 7 minutes either.
No, that's not. We'll spend adequate time with you to find out what's going on. And yeah, you'll also get a lot of advice on what you should do. So, you know, that'll be valuable for you. You can just, you know, stick with your own private doctor. You think you know enough to do this on your own, and you've had some medical intervention and you know where to go and what needs to be done. And so maybe that short visit with Dr. Lim is enough, but I don't think so. I really think that you really need the whole 12 days. You need the support that's provided by our sports specialist, Stacy and Tiffany and Corey. They spend every day with you for those 12 days. You need the education that Jeff Novick and Doug Lyle and myself and Heather and Mary provide you. You need the daily support where every morning we spend 45 minutes or more with you during morning chats. It's a very, very familiar time. You know, we go over all kinds of issues, but it's not a lecture type thing. You need to hear the lectures too. And you know, quite honestly, you could get all the lectures pretty much, not all of them. You get most of the material either by going to the website or going to YouTube. I've had the attitude, and I still have it, that I want to give it away for free. Why? Because, well, you know, there was a time when we couldn't sell it. Nobody'd buy it. That was 50 years ago. And the other thing is that I used to be a very unhealthy man. I would have been dead in my 30s if I hadn't learned this. Mary would have probably been fine. She'd have been maybe 40 pounds heavier than she is now, and probably one artificial hip or something. She'd have been alive. But my life was saved by this information. And so Mary and I feel an obligation to give back. And that's why we've always offered the program for free. You want to put a little extra effort, you can have it for free. You want professional help, we have to charge you for it. But you're going to walk away like everybody does. They're saying, this is the best time and money I've ever spent, these 12 days.
Great, thank you. Here's a question I saw. Do you have any advice for thyroid nodules, asks Brigitte.
Yeah, you shouldn't look for them. And once you find them, you should not do anything about them. That is what the scientific research says. You look up thyroid nodules and you'll see the great controversy. The idea is the thyroid nodules are precancerous. Rarely. And most of them are just a cosmetic issue. In other words, if they get too big, a lump in your throat, in your neck that is bothering you cosmetically, then have it taken out. But if you're worried about developing thyroid cancer, no, you don't do that, because almost all of them are benign. And you shouldn't go looking for them. Anyway, you can leave them alone. That's my best advice to you. You get some indication whether there's any possibility of there being cancer in this nodule by doing other tests, which they'll do for you if you find nodules. But you're better off in most cases of not doing anything, just leaving them there.
Great, thank you. Question, have you heard about Dr. Avi claiming that you can't reverse heart disease on a vegan diet?
No, but this is the day and age when the First Amendment is so important to everybody, and you can say pretty much anything you want and get away with it. What he has to do is he has to contradict obvious things like the body does heal. And if you believe, like I do, that there's a cause of rotten arteries, of coronary artery disease, if you believe there's a cause, then if you stop the cause, the body ought to heal. If you believe the cause is the food, which almost all scientific research says it is, then if you change your diet, you're going to heal. If you believe Dean Ornish's studies and Caldwell Esselstyn's studies and David Blankenhorn's studies, you'll see by scientific studies, we show reversal of artery disease by changing your diet.
But a vegan diet doesn't necessarily cure all these things, because a vegan diet can be anything that doesn't have an animal in it.
You can live on Cokes and potato chips and be vegan.
And all the fake meats, and they even have fake eggs now. And so, you can have a typical American diet, but it can be vegan. And it looks the same, and it's just as unhealthy.
Thank you, Mary.
So we don't have a vegan diet. We have a starch-based, plant-based diet that just happens to be vegan.
And we couldn't figure out any benefit to adding dead animals or animal secretions to this diet of potatoes and rice and corn. If there was an advantage to it, if it turned out to be a better diet, I'd have put it in there when I was developing this 50 years ago. But every time I tried to improve upon a starch-based diet with fruits and vegetables, I ended up making it worse. Anyway, like I said, this is a day and age when you can say anything you want and get away with it. You can even be president. Well, I'm not going to go into those. Never mind, no politics. But, I'd be disgusted at what's going on in the name of free speech these days.
Yeah. Here's a fun question. You both can answer it. How desperate would you guys have to be to eat junk food?
Oh, you have to be hungry. Hey, I'm not going to die of starvation. I don't think I'd go as far as cannibalism. But I would, to stay alive. Have you ever been hungry? If you want to have an experiment about your nature that you could get a good education from, just stop eating. Just don't eat. And you'll find out in fewer than 3 days what your hunger drive will cause you to do. Mary and I were involved in a church probably 45 years ago. And at that time, we were worried about starving Africans. And so, me, I stood up and I said, okay, if we want to show our concern for starving Africans, why don't we feel what it's like to starve? And I got most of the congregation to go along with me. And so on Friday night, we stopped eating. We could have water. Saturday morning, I started thinking about food. By Saturday afternoon, that's all I thought about was food. I didn't have any more money problems. I didn't have any more legal problems. I didn't have anything on my mind except food, eating. And finally on Sunday, we got together for a dinner. And I want to tell you, if it had been white bread and water, I'd have been thrilled. I was so hungry. You want to learn about your hunger drive? Just don't eat. And then you ask me what you'd eat if you were really, really hungry. I'd eat pretty much anything. That's because my body intends to stay alive. But I'm not confronted with that possibility. I have a choice between filling up my stomach with foods that'll kill me and filling up my stomach with foods that support better health. I don't think you're going to starve and not eat anything available that provides calories. I remember reading that book, and I think about this a lot, Mary, about the guy who was a prisoner of war in World War II. What was the movie they just put out about this fellow? Remember he was the runner. He was a runner, and he was captured. I believe it was a Japanese prisoner of war camp. You know what it is. You know that movie. It's a book. I read the book.
I did too.
Yeah.
I don't remember now.
But this guy would eat paste off the wall. He was so hungry, and this was a treat. You know, it was a paste, a glue. A good book to let you understand what it's like to be under a lot of duress. Try being a prisoner of war. Boy, that's scary.
Wow. Thank you. This is from Peter. If a person doesn't have an addiction to it, from a health perspective, how does Dr. McDougall feel about a celebratory glass of wine a few times a year? But who can do it a few times a year? I don't know anybody that can do anything a few times a year.
Well, they're known as moderate people.
Well, we're not one of those.
That's not us, no. It is true that alcohol is sociable, wines taste good. And for 9 out of 10 people, it'd be just fine because you can drink, occasionally, and you're not an alcoholic, and you don't get behind the wheel of a car. You don't go home and beat up with a wife and kids. But for 1 out of 10 people, it's not that way. They do get behind the wheel of a car and kill people. And they do go home and beat up the wife and kids. These are called alcoholics. So you can't put alcohol and health in the same sentence because of that. However, if you're in the 9 out of 10 that doesn't have this affliction, and unfortunately, many of you don't realize you've got a problem, then, I agree. I think you having an occasional glass of wine is of no detriment at all, but for a medical professional to recommend alcohol to the general population is malpractice. Shouldn't be done. The destruction, the damage is so great.
You said in your talk that caffeine raises blood pressure. So why are so many doctors recommending caffeine, even cardiologists?
Probably because they drink coffee themselves. I don't know. It raises cholesterol, it raises blood pressure. I'll give you a tip that was worth your time spending with us this morning. There was a lot of confusion back in the 1980s about coffee raising blood cholesterol. Good research published in the scientific literature, half of it showed that drinking coffee raised cholesterol by about 10%, but the other half didn't. And these were both run by good scientists. And then they looked at the methods of brewing and they figured out why. If you cook your coffee in a strainer, percolate it, then you raise cholesterol by about 10%. If you cook it through a coffee maker that uses a paper filter, you remove the cholesterol raising fatty acids by the paper. And so you don't see an elevation in cholesterol in those who drink paper filtered coffee. Now, wasn't that a good tip, huh?
But it could still raise blood pressure.
Still raise blood pressure, and decaf coffee raises cholesterol even more than regular coffee. And yeah, there's a whole bunch of things wrong. Coffee is not health food, folks. Coffee is fun. Coffee's a drug, a la Starbucks. Biggest drug dealers in the whole world, Starbucks. So.
Well, now they have these really fancy coffee machines that you can make your own espresso shots at home and all this fancy stuff because people really like their coffee.
Right. Never too high. The higher, the better. So you know exactly what I'm talking about. And you can tell by experience, I do.
Is green tea just as detrimental? Because that has caffeine.
It does, but it isn't. If you look at the studies on tea drinkers, they may initially raise the blood pressure, but it comes down, even if it's caffeinated. And they show no increased risk in heart disease. I don't believe that raises cholesterol either, but it's not the caffeine that raises cholesterol. It's other alkaloids in the coffee pod. So, both contain caffeine, but both don't contain the alkaloids that raise cholesterol. And likewise, you don't get this serious indigestion from drinking tea that you get from drinking coffee. Now, every serious coffee drinker carries around a pocket full of antacids because they have constant indigestion. But the thing to note is that you have just as severe indigestion on decaf coffee as regular coffee, because it's not the caffeine that causes the acid production. It's other alkaloids that are in the plant. So just by removing the caffeine, you don't make caffeinated coffee better, except for the caffeine effects. Of course, that may be a big deal for you. You may want to do it that way. But my philosophy has always been, if you're going to drink the disgusting stuff, you might as well have some fun doing it. So why drink decaf? Again, you can tell a lot about me if you listen carefully. I've been able to, even though I've had a lot of bad habits in my life, and you know that I don't hide them, I've been able to get control of these things and not ruin my life. Otherwise, I'd have been dead. We're talking about tobacco. We're talking about alcohol. We're talking about food. I almost killed myself on many occasions, too many occasions. But, by experience, I learned that you shouldn't do these things. And hopefully most of you have learned the same thing. But I know there are some of you that are just goody two-shoes out there and you don't do anything bad. So I'm probably not talking to you.
Funny. Great. Thanks. There's a question about something you spoke on in the past, hormone cream. Does it have any side effects to the breast or weight? Okay.
In the book, the McDougall program for women, which is free, you go to the shop on the website and you order the book. And when you get down to checkout, you see that there's no charge for the PDF file. And the McDougall program for women talks about all kinds of women problems, all the way from hysterectomies and fibroid tumors to menopause, to precocious puberty, osteoporosis, heart disease, and so on. And chapter 13 is about hormone replacement therapy. And what it somewhere in that chapter tells you is that the way to take hormone replacement therapy is through skin creams that are made of estradiol, which is the hormone that you made when you were still menstruating, and progesterone. And so these two hormones are combined by a compound pharmacy. They're much more potent than hormones taken by mouth. They're much more reliable than hormones taken by mouth. So it's the preferred way to deliver the hormone to your tissues. But they have adverse effects, all right? People who take hormones have more gallbladder disease. They have more blood clots. They stimulate the uterus and keep the uterine lining from continue to shed. You develop abnormal menstrual periods, heavy menstrual periods, blood clots, uterine cancer from estrogens. So yeah, these are real drugs. They're real hormones. You need to be careful. You need to decide that this will do you more good than harm. But I find this in a lot of women is they need to have some relief at the time of menopause. And so I do prescribe more than just an occasion. I used to be a big part of my practice, not a real big part. Nobody ever knew. But I used to prescribe commonly to women at the menopausal years skin creams, and most of them were really happy with this prescription. They didn't feel a lot better. The other situation I prescribe hormone replacement in is when you want to fool Mother Nature. Mother Nature says that after the time has passed when you can have babies, you're not supposed to have, or you don't need to have sex anymore. Well, a lot of us have passed that age where we can have babies, but we still want to have a little fun. And so hormone replacement creams, estradiol, estradiol, not Premarin.
Not Premarin.
Yeah. Hormone replacement creams may be a nice addition to a woman's body that would make her have a better sex life because the vagina becomes very thin. As I say, nature says there's no reason to have sex after you can't have babies. So the vaginal tissues become very, very thin. Well, if you are not comfortable with that, then the way to deal with it is have your doctor prescribe estrogen creams, vaginal creams. Every doctor can do it. Every doctor has these creams. They don't have to be made by a compounding pharmacy like the skin creams do. And I think you'll find them valuable. I think that you probably will end up taking them every day for a week or so till you get the vagina toughened up. And then you maybe will need them just once a week or maybe twice a week to keep things the way you want. If you have sporadic sexual relationships, in other words, it just happens once in a while and you can plan for it, you can just use the estrogens a few days before that activity. And again, trying to minimize the drug therapy because it has adverse effects and taking advantage of its positive effects. Anyway, all that's discussed in the women's book, which is free at www.drmcdougall.com. You go shopping, and as I say, when you check out, you can get McDougall's Medicine, A Challenging Second Opinion, the McDougall Program for Women. I believe the McDougall Program for Heart Disease is also free. There are 3 more books that I'm going to give you as time goes on, free. Why do I do it for free? Well, you know, I think you ought to spread the good news. And if I can help you in any way, then I'm going to help you. I'm going to give you the written material that I worked so hard putting together in 13 national best-selling books. I want you to share it with people. When you get that PDF of McDougall's Medicine, A Challenging Second Opinion, you should send it to everybody you know. You should get the mailing list for the Harvard Medical School and send it to all their young doctors. You know, spread the good news. Help me, please help me.
You remember that saying, it's not nice to fool Mother Nature.
Well, you know, AJ, I need to go into your personal health, but I sure know about your attitude. And my guess is that, well, no, I'm going to stop there.
That's funny. That is so funny. Do you think you'll ever write another book?
I don't think so. I've written pretty much everything that I've known about and become an expert on. I was going to write a book on diet and climate change, but that was written. It's called Food is Climate. It's really, really a good book. You ought to read it. And so I was going to write that book, but I couldn't quite make the deal with the book company to do it. So I didn't do it. Instead, I put together a website on diet and climate change. And we're just starting to release this website. And you're welcome to visit it. It's not quite finished yet, but it's close enough that it will do more good than harm for you to take a look at it at this stage. It's under the following link. It's www.mcdougallfoundation.org, not .com, but .org. And I think you'll have a lot of fun visiting that website. The dedication is to, the theme is what can one person do to help mitigate climate change. You know, what they can do is they can change what they eat. So there's so much dismal information out there about the climate. New York Times put out an article yesterday that talked about there is some hope. And my website is dedicated to optimism. There is hope. There are things we can do. And so what we can all do is we can change our diet, and that will do more for the planet than anything else. That's what the website is dedicated to. It's mcdougallfoundation.org. If you have any comments, you know, send them to me. I certainly would rather have criticism from you folks than from the people that I'm hopefully going to meet someday soon, who have an interest in seeing me fail. You can imagine there are a lot of people out there that would like to see me fail.
You're such a resilient person.
You know, I've got a lot going for me, AJ. I'm healthy. I've got an amazing partner in life. I had an opportunity to good education, and I work hard, and was pretty hard to fluster me.
I know, but the way you guys bounce back from the fight, I mean, like, it's amazing to me, both of you. Lesser things have happened to me and I freak out.
Well, you had to get over losing everything. You know, when we lost everything in the wildfires of California, the attitude I had to take, or just to get through it, was how many people get to start their life over again when they're 70? You know, how many people are lucky enough to have to put themselves in a situation where the kids and grandkids didn't have to sort through all the garbage you collected in the basement and the attic? Our kids don't have to do that now. Everything was sorted through in 5 minutes. You know, I got tired of the scratches on my car. Didn't have to worry about them anymore. Teslas melt. Oh man, that was a mess. I went out to the garage and I had a Tesla and I had a truck, and you could, we had an Audi too. And you could see the frames of the truck and the Audi. Whereas the Tesla, because it's made of aluminum, was just a puddle. That hurt me. That broke my heart. I love that car.
Well, we didn't spend a lot of time going through the, whatever was left, the ashes. We just decided we don't want to look at it anymore. And so we just had it all just.
Moved to Portland.
Yeah. Yeah.
That's such a great attitude, because Charles has so much crap. I mean, I don't want to be in a fire, but I mean, that's how I would look at it too. It's like, yay, decluttering, you know?
Really?
And you didn't lose what was most precious. So that was
no, nobody got hurt. We were about 3 minutes from being burned alive. Fortunately, our grandkids were persistent and, you know, had to almost knock down the door to wake us up. But, you know, that happened at 12:55. At 1 o'clock, the house was gone. So it was, I don't like to look back at those times. Yeah.
Yeah.
Anyway, we've been very fortunate. I have no complaints at all. But it was a bit disturbing for us to lose everything that was material. We lost.
Yeah.
I don't have all the scientific papers I collected for 40 years. That bothers me a bit. A whole basement full of file cabinets of research papers, and they're all gone. But fortunately, I put most of the important ones up on the internet, and so I got the really good ones. And there are lots of things that Mary looks at that bring back memories. But we're over it. We have had to let it go. You know that. Many of you have been through some tragedies in your life. What's much worse, that's the other attitude I took, AJ, is that what happened to us was nothing compared to what happens to my patients. Really, I mean, I would hear from people every day, 3 or 4 or 5 times a day, with problems that burning your house and losing everything in your home paled against. Our problems were tiny compared to theirs. So I've taken that attitude too. You know, what we went through was basically nothing, no big deal, compared to what some of you had to go through.
And you're so good about taking criticism. I mean, like, it doesn't bother you when people say bad things about you. Like, I crumble.
Oh, well,
you don't see him afterwards.
Yeah, well, you know, the truth of the matter is they very, very seldom say things to my face. I don't know why, but it's, I hear about it usually secondhand behind my back. You know, what are you going to say about me? You know, what are you going to say? Because, you know, I put together some pretty solid science.
Yeah. Well, everybody here loves you, and they're remarking on your eidetic memory, how you remember exactly the newsletter of.
Oh, isn't that amazing?
You should go on Jeopardy, Dr. McDougall. With your recall, you'd be able to.
He doesn't know trivia. He was never any good at Trivial Pursuit. So he's only good at medical journals and newsletters that he's written.
That's because that's what I love.
They're his babies.
Those are the things that get me excited, you know, scientific papers. I can't tell you the last time I read a novel. Mary reads 3 to 5 novels a week. I read 13 journals a week. Just weird. What can I say?
That is something. Well, we have a question from Elizabeth asking if you can touch on bone density, and from EJ, what to do for painful periods.
Well, let's take the painful period thing first. If you change your diet within a couple of menstrual periods, your periods will become lighter. They'll become further apart and fewer days of bleeding. And the clots should go away too. Now, when I say that by the next period or two, a lot of this depends upon how much body fat you have. Because body fat makes estrogens, and so you may have to wait till you hit trim body weight before all the things that I told you are true. If you are near the years of menopause, and menopause means you've dropped your last egg, you've had your last bleed. If you're near the age of menopause, you'll go through menopause right about the time you change your diet. That'll take care of your periods. You know, going on a low-fat diet, losing the weight, you'll stop menstruating. So that would handle the issues very big time. And of course, there are some reasons for bleeding that are more medically important, and you'll want to see your doctor about that. But just generally heavy periods, blood clots, prolonged periods. It's a hormone imbalance created by eating the Western diet, easily fixed by changing your diet. The other question was, what was it, the other question?
Could you please touch on bone density?
Oh, bone density. Bone mineral density testing was not even paid by Medicare until about 20 years ago because it's so inaccurate. But they finally pushed it through, particularly the drug companies that sell drugs based upon the bone mineral density. In fact, it was 3 drug companies that got together for the committee that formed the committee for the World Health Organization that determined the use of bone mineral density for women. 3 drug companies. Anyway, it's what it does is it measures the density of the bones. In other words, it measures the amount of mineral in the bones. Naturally, 70% of women have a precipitous drop in their bone mineral density when they go through menopause. 70% of women are diagnosed as having osteopenia or osteoporosis by the age of 70. Why? Because when you're a woman in your reproductive years, you store 2 pounds of minerals in your bones for the baby's bones and for the breast milk afterwards. You store an extra 2 pounds in your bones. Well, when you hit menopause, your body says, oh, I don't need to carry this 2 pounds around all the time. And so, because I'm not going to have any babies. So the body naturally dumps the minerals, but that doesn't mean the bone strength is reduced. Bone strength and mineral accumulation has a very weak relationship. That's why bone mineral density tests aren't very predictive as to your risk of having a fracture, is because you can have strong bones, and most people do, without all this mineral. This mineral, the bones are just a depot for the place for the minerals to sit. Bone strength is determined by tissue. Let me give you an analogy. Something with a high mineral content would be a piece of chalk. Okay, you remember chalk when you used to write on a chalkboard? That's 100% mineral. How strong is it? How much does it resist fractures? Okay, remember the days when you used to eat chicken and you got done stripping the leg off the chicken, what you ended up with is bone. And you'd take and twist the bone, you could almost tie it in knots because it was the tissue you were looking at. As I say, the correlation between bone mineral density and bone strength is very weak. Bones hold on to the minerals for the day when you have a baby. And when it's time to not have babies, your bone density decreases. But your doctor doesn't know this. And so therefore, you flunked the test, lady, you're gonna have to be on the drugs. Don't argue about it, just take them. Why does the doctor do that? Because the doctor was taught by the drug companies to sell drugs. We are the best drug pushers around. We're all day long advertised by drug companies to sell their products. And of course, it fits well with our business too, because talking to people takes time. But I can hand you a prescription and have you out of the office in 7 minutes. Next. And Mary commented a couple of days ago about all these ads on TV for treating arthritis, $30,000 for the drug for a year, multiple sclerosis, $70,000 for the drug for a year, diabetes drugs, the new really fancy ones, $24,000 a year for the year of drugs. Well, when on TV, they tell you about a problem that you may or may not have. If you think you might have a little rheumatoid arthritis, et cetera, or bowel problem, et cetera. What do you do next? You go to the doctor. That's right. So they drive you into the doctor's arms.
And you ask for that pill that you saw on TV.
Yeah, I want this one right here.
Or the injection.
Yeah. No, it's not that it's not that doctors are dishonest or do only harm. There are a lot of good doctors out there. And there are a lot of good things that were available to help you with. It's just by and large, it's a crooked business.
Just spend some time listening to all the negative things that they tell you afterward. This may cause, and there's a whole list of
90
things.
seconds of things that ought to scare you to death about taking this drug. But they told you, so when the lawsuit comes up, they can say, well, I told you, you should have known better than take this drug. It gave you cancer, killed you. Well, I said so in the disclaimer after the pretty girl running around in the field and smiling and laughing and having a great old time because she's taking the drug.
Yep.
Excuse me, ladies and gentlemen, get out of the business. Get away from these people. And the only way you can do that safely is to be a healthy person. And the only way that most of you can be healthy is to figure out what the problem is. And the problem's of food. And the answer is a starch-based diet with fruits and vegetables, a little exercise, and some sunshine. That's it. Costs nothing, no side effects. It always works too. I've got 12,000 people that I've taken care of in my career that would tell you that it works. Now, not all of them have had great success, but they've at least had enough experience with what I do to know it works.
Well, and you have a lot of people that have also done this on their own, so you don't even know about them.
Well, yeah, we get letters, amazing letters from people from all over the world, from all times in our practice. And one of the things that makes me feel best about being a doctor is when I get a letter from somebody and they say, well, Dr. McDougall, I heard you give a lecture 50 years ago at St. Francis Hospital in Honolulu, and you taught me about how to eat. And I just want you to know, my friends, all my friends are the ones that aren't dead are in assisted living facilities, and they have disability stickers, and I'm having a great time with my grandkids and my kids, and I'm still working, and I know that's because of what I heard you say 45 years ago. Then I feel like I've really done my job. You can help anybody for a day or two, or even 12 days at our program, but to make a difference in somebody's whole life and to have them appreciate it, which we have, I would guess I probably hear from 100 people a year. Those are just the ones I hear from who write me and thank me. And boy, do I feel good about that. That makes my day when I know I've done that kind of service for a person.
Question, can we heal the kidneys?
Well, lots of bad things can happen to the kidneys. Depends on what you're looking for. You're not going to grow a new kidney back. However, if you lose a kidney, your one kidney will proliferate. So you sort of do grow a new kidney back. Kidney damage is commonly caused by atherosclerosis, the Western diet, and that's the most common cause of kidney disease. They say the diabetes caused it or the high blood pressure caused it. Well, what caused the diabetes and high blood pressure was the rich food. You might as well go back to that. And some of that can be reversed. If you take any reason for kidney failure, and there's a whole chapter in the book, McDougall's Medicine, A Challenging Second Opinion, which many of you will go to the website and get for free. A whole chapter on kidney disease, what it tells you if you feed, and we've known this for 100 years. Every doctor knows this who has any interest in kidneys at all. If you feed people with failing kidneys a low protein diet, you will dramatically improve their kidney function and you will slow the progression of their kidney disease down. So likely most of them, or many of them, will not have to end up on a dialysis machine. Whether you have polycystic kidney disease or you've lost a kidney because you donated one to somebody, lost it in an accident, lost it due to an infection, doesn't matter. If you take good care of the remaining kidney, it's likely to last you a lifetime. You're so over provided for as far as kidney function. You can lose 90% of your kidney function, at least 75% of the kidney function before you notice anything. 25% of kidney function is enough to clear all the waste that the body produces. You won't even know you had any loss of kidney until 75% of it's gone.
But what about if you eat an unhealthy diet?
Well, then what happens is you rapidly get rid of the last 25%.
Okay.
By eating a good diet, you keep that 25% of kidney function. Anyway, you can either get the book, which I told you how to get it, and you can read. You go to the website, go to Hot Topics, you go to kidney disease. There's an article I wrote a few years back, big, thorough article. Send it to your friends, your fellows, your physicians, and so on. It's a PDF file, which talks about diet and kidney disease and tells you about a lot of the things that I just tried to share with you and much, much more, because I wrote it down. Because I knew there would be a day when I couldn't remember all of it. So I wrote it down. I put it in books and newsletters, and I put it on video because, you know what, believe it or not, ladies and gentlemen, I'm not going to be here forever. I know, you're disappointed. Dr. McDougall's never supposed to die. He eats vegetables.
That's funny. Well, when you do, we have another one.
You have another doctor?
Oh, that's right.
Yeah,
Craig.
we have Craig.
We have Craig.
Shoot,
Yes, you do. And he's a great doctor. For any of you, well, he's a professor at OHSU. And any of you.
But he still sees patients.
He does, but it's really hard to get into his practice. Unless, of course, you have a connection. And our patients who've been through our program, I will often make available to them doctors who otherwise wouldn't take them into their practice. But, you know, I'm not going to put that kind of effort into people unless they are willing to put some effort into themselves. You know, you come halfway with me, you take the trouble to learn the program, and that really means you come to one of the McDougall programs, either the previous hospital-based program that I did for 16 years at St. Helena Hospital, or the resort-based program that we did for 18 years, or now the telemedicine, telehealth program we've done for 2 years. And you become a McDougall patient.
Almost 2 years.
Yeah. Otherwise, you don't call up and make an appointment. But if you're a McDougall patient, you're a patient for life. But you only get to be a McDougall patient if you're willing to put some effort in that we can see, to at least learn the program, at least try. Life's too short for me to have one-night stands.
Nice. You know what? So I don't think the people watching know that I stream to 7 different places. So what I see in my chat goes quickly. And so some of the questions have disappeared. So if you want to repost, you can, because there was one that I really wanted to ask about somebody who said they're eating the way you suggest, but still had an ischemic heart attack. What more could they do?
Yeah. Well, you know, what I would say is that 150 years ago, heart disease was not described in the United States. And there are parts of the world up like 50 years ago, there were no heart attacks, like in rural Japan or rural Africa. So I have to assume that you can make a big dent in the progression of this disease by going back to these traditional diets, like people ate in Japan or in Africa, starch-based diets. Do things always happen? No, they don't always happen. There are always exceptions. But in general, people who truly follow the type of diet I recommend, unless they have diabetes, unless they have a whole bunch of metabolic problems that set them back, they don't have heart attacks. They don't have strokes. That's been my experience. Very rare. And, but it's no guarantee for sure. But you have to understand, some of the people that I see, they are seriously overweight. They've been diabetic for many years. You know, they're really, they have bad tissues, and they're past the point, not of helping, but of promising immunity, or really, you're going to have a great life without serious health problems. Now, I can't do that. For some of the people who have progressed to the point where they have their systems really, really damaged. Otherwise, I think it's fair for me to say that if you follow a good diet, you'll avoid dietarily caused diseases, which are probably 90% of the afflictions that people have in our country. We're talking about heart disease, coronary artery disease. Affects half the people in our country either have heart attacks or strokes. 100% preventable. You know, cancer is, let's see, I'll give you the data on cancer. A lot of people get cancer. You know, I believe it's around, well, anyway, let me not throw statistics, I can't remember it. But these are dietarily caused cancers like breast and prostate and colon. You know, prior to World War II, these were not described in rural Japan. They had no breast cancer. I got a letter from a women's group recently that is a group of women in Japan who have breast cancer. And they reflected on the facts that their mothers never saw a case of breast cancer in Japan. Their grandma never heard of a case of breast cancer in Japan. This is a disease that exists when you introduce the Western diet to a country. T. Colin Campbell's, the China study, he showed that in various communities, when you reduce the fat intake from, say, 40% to 7%, which is naturally present in the starches, vegetables, and fruits, when you reduce the fat intake, the chance of dying of breast cancer decreases. There's no threshold. It's not like at 20% fat intake, you start seeing the effect of fat. The lower you go, the less your risk of having breast cancer. So that should tell you that, you know, there's no safe threshold. You need to do the best you can.
No, there are people asking about mammograms, and you've already done a talk on this channel about breast cancer. But Gina said, what if you have the gene for breast cancer?
You mean like the BRCA gene?
I'm guessing she just said gene for breast cancer, but then do you still not
recommend? There's a BRCA variant, BRCA1 and 2, which occurs in some women. What's her name?
Angelina Jolie.
Angelina Jolie, I believe she had it. And you have a high risk of getting breast and ovarian cancer. The interesting thing is that cutting off your breast does not change your risk of dying of breast cancer. Cutting out your ovaries does. And if you look at the lecture that I gave on breast cancer, you know that removing estrogen stimulation is part of the treatment that I offer women who have breast cancer, because when you cut out the estrogens, the cancer doesn't grow as rapidly in the breast. So it's kind of interesting. And people who have the gene, you know, they're getting their breast cut off a high rate, prophylactic mastectomy. And they always leave a little breast tissue behind, even though they try and be thorough. These women, they'll have the breasts removed, but they won't have the ovaries removed. And
so they should have a prophylactic.
They should, yeah, they should, yeah.
Okay.
You know, if they really want to do something, no, they should change their diet. That's what they ought to do. But if they want to have some extra benefits, they can go on an anti-estrogen program, like taking tamoxifen. Tamoxifen is been used to prevent breast cancer. It's an anti-estrogen drug. And they can have the ovaries removed. Women who don't have ovary function throughout life never get breast cancer. Okay? And there are, you know, some situations where a woman is deprived of ovary function throughout her whole life, never get breast cancer. That's an article that got burned up in my basement.
I never heard that.
Actually, I wrote that. I think I wrote that in McDougall's Medicine: A Challenging Second Opinion.
Okay.
And
so the reference would be there too.
Probably, and if it's not there, it's in the McDougall Program for Women. 2 books that I offer you for free at the website. You'll find it there. Just look through it and find it. You'll find it. I usually remember where it is, but not always.
Great. This is a fun question for you, Mary, from Kathy. Have you ever won an argument with Dr. McDougall?
I don't know.
See, neither one of us can remember.
No, we really pretty much are simpatico. You know?
Yeah, we don't argue very much.
Yeah, we really want kind of the same things in life. We always have, and that's why we got together. Because we're both very positive people who I think look at problems in life similarly. And
I think whenever we have maybe a disagreement about something, either one or the other of us will come up with a solution and say, "Hey, what about this instead?"
well, I have to say that if you want the answer to the question, is I acquiesce.
Acquiesce.
Thank you.
Yes.
I to Mary, because she's really a smart woman. And quite often I recognize that I'm wrong real quickly into any type of adversarial discussion. So I've learned that about her. Is I picked a really, really good mate. 50 years ago, I didn't make a mistake, ladies and gentlemen. But I had some great parents that taught me how to pick a mate. They said, John, you have to marry somebody who likes themselves. You have to marry a happy person because they're never going to make you happy. You're never going to make them happy, they said. And of course I took it personal, but the truth is you can't change people. And so what you end up choosing early in life, that's the person you married. You're not going to change them. So I looked for a happy person. And the other thing my parents told me they taught me about honesty. And they said, Johnny, if you're honest, you'll know who that person is when you meet her. And I dated a lot of very, very nice young women before I met Mary. And I'll tell you, I fell in love at first sight. I knew she was the right one. And I could just feel it. I just knew it. And the 50 years we've spent together, we had our 50th anniversary just a couple of months ago, I think pretty much proves it. And I think the 3 highly successful children we raised pretty much proves it. I think the fun we had in life pretty much proves it. We've done so much together. We have sailed sailboats across the ocean. We've taken people on adventure trips all over the world.
We've flown airplanes.
Yeah, we're both twin engine IFR rated pilots. Or on an airplane and flying on an airplane all over the country, you can get in some really serious arguments. You better solve these arguments quick too. Otherwise you're going to be dead. All right, Mary, what do you think you ought to do here? Or you better get it right. But anyway, we've had a lot of fun together.
What do you guys do for fun? Because you're reading your journals, Mary's reading her novels. When do you guys get together and have fun?
Well, at our stage in life, AJ, and Mary would add to this, I think, what she feels about it. We spend a lot of time with our children and grandkids. We get a lot of pleasure out of that. We go for walks every day like that. Mm-hmm. There's certain TV programs that are our favorites. We enjoy those. We have a few friends, not many, that we enjoy. And, we don't do the things that we did early in life, like scuba diving, sailing sailboats and flying airplanes. And
we don't ski anymore.
No, we used to own a condo and ski 60 days a year. Those times.
You learn to be a little more careful about your body when you get to be our age.
Yeah. Because
you don't want to fall.
We gave up skiing a few years back. Not too many years back. I think it probably just before
when the fire happened, because we had just bought new skis.
Yeah, the fire really changed our lives a lot. Everything, I had 11 windsurfing boards. We had, really nice ski equipment. But we had a lot of the things that we did for hobbies. All of the tools were in our garage, and they were gone, and we just didn't see any reason to replace them. But I am going windsurfing again. Yes, I am.
Where can you windsurf around you? Is there a place?
Columbia River. I've been out there.
Out in Hood River.
Hood River.
Okay, good. Excellent.
Yeah.
All right. I know how you feel about vitamin D, but Susan says if your blood test shows it at 25, even though in the sun an hour a day, more than an hour a day, walking and swimming, do you still not recommend taking vitamin D?
Correct. I don't recommend taking it. 25, by the way, is in the normal range for many laboratories. But
You can tell the story about the Hawaiian surfers.
yeah, there's a study, and you'll find it in the newsletters that I've written on vitamin D. Just go to the website, enter vitamin D. But they did a study on surfers who spent an average of 28 hours a week in the sun, and half of them flunked the vitamin D test. So there's something wrong with the test for sure. One of the problems is that the test has been pretty much invented to sell you lab tests and drugs. So it's set up so that most people fail, so that they become customers. Not based on any really good science that says you need a particular level of vitamin D to be most healthy. The other thing is that your vitamin D level depends upon whether or not you have chronic inflammation. And you get chronic inflammation from eating the Western diet. That's where it comes from. You're chronically inflamed because of the bad foods. And so it also is expressed as things like diabetes and arthritis and obesity and so on. But it's really just plain old inflammation that occurs from an uncontrolled fork and spoon. And a byproduct of inflammation is a substance that lowers vitamin D levels artificially. So if you're truly going to correct your vitamin D levels, you need to correct the inflammation. And in other words, you got to correct the food. The other thing that you ought to be well aware of is that as far as my reading skills go, over the last 15 years, I can find no studies that disagree with this. And that is that if you're going to take more than 2,000 international units, and many are prescribed 5,000 and 10,000, if you're going to take more than 2,000 international units, all the studies done show that you increase your risk of falls and fractures. Because this level of vitamin D causes new imbalances in your nervous system and muscles, which cause you to fall. Now, there are many, many other studies that show even lower doses of vitamin D will cause an increased risk in falls and fractures. But that's what the research says. So if you buy into the idea that there's something wrong with you because your D levels are low, which you never thought about checking because you always believed that vitamin D was the sunshine vitamin, you got plenty of sunshine. That was always good enough for everybody before the meddling influence of the vitamin supplement companies and the laboratories and the doctors who order them.
The disease mongers.
Thank you, Mary. Okay, sunshine always worked before, and if you're going to get adequate sunshine, which is not a lot, a white person like me needs almost none. Tiny bit at noon, 5 minutes a day on my hands and face will do it. You know, if you're going to buy into the drug business, you need to realize these drugs are dangerous. You need to understand that, you know, people who get lots of sunshine flunk the vitamin D test. You need to know these things, and maybe you'll decide not to take it. Mary flunked the vitamin D test when we got one done on her. We'd been to Hawaii and Costa Rica. We had a backyard swimming pool at the level of Santa Rosa, California. I used to sit out there every day, and she flunked the test. Anyways, she didn't take supplements. But sunshine's important. It's really crucial you get sunshine. I've mentioned it at least 6 times just in the last 2 hours. You need to get sunshine, not just for the vitamin D, but a whole bunch of things that happen to your body that are dependent upon sunlight. Yeah.
Even your mood.
Your mood, yeah. That seasonal affective disorder, that's everybody's heard about that, how you use light boxes to change your mood, to get you out of depression. Sets your circadian rhythm. Affects whether or not, affects your jet lag when you go to a different part of the world. You reset your internal clock by the sun rising and setting.
Okay, here's a really fun question for both of you. If you hadn't become a doctor, Mary, a nurse, what other professions do you think you might have been?
Well, unfortunately, I grew up in a family that believed that there were really only two professions for a woman. You could either be a nurse or a teacher. So, you know, if I hadn't had any other influence, you know, I probably would have been a teacher. That's what my sister was. I was a nurse. My sister was a teacher. And so I didn't have the kind of family that John had when they said, you know, you could be anything.
Yeah, my parents raised me with no limitations. You know, they told me when I was a kid, I could be president if I wanted to be president. And I know some of you have been raised in those kind of families too, so you understand what I'm saying. If I had not become a doctor, the ocean is my love. I'd have been an oceanographer. You know, I'd spent my whole life dealing with sea life. And still, it's where I spend most of my time as far as outside activities, is windsurfing, sailing, scuba diving, swimming. It's been my whole life, is the ocean. Of course, yeah, it's a tough life too. It's hard to have a family to be an oceanographer and be out on a ship all the time. And I imagine the pay is not as good as, say, a doctor, and that would have been a little tougher. I'm glad I became a doctor. You know, many of you know the reason I became a doctor is because I had a stroke when I was 18. And by the way, I found the picture. I couldn't believe it. I thought that everything was lost in the fire, AJ. But I found a picture of me sitting on my hospital bed at Grace Hospital when I was 18. You know, the day after I had my stroke. And I'm sitting there on the bed. I've got an oxygen cannula in my nose, and I've got a pack of Marlboro cigarettes sitting on the table in front of me. I believe me, the way I took care of myself, I'm lucky I'm alive, but I found out some really important things about food in my mid-20s, and otherwise I wouldn't be talking to you right now today. I'd been gone. Quit the tobacco too, sure did.
Mary, I was raised in a Jewish family, and there was only one profession that was acceptable, and that was doctor.
Oh, really? Oh,
Yeah,
okay.
really. And I didn't become that. But do you know what the first words a Jewish baby girl says the minute she's born? So you're a doctor? And that was it. I went to the University of Pennsylvania, but I went to an Ivy League school, but I just couldn't do it. I don't like blood. I don't like touching people. Ugh, you know, I just couldn't do it. Tried.
Yeah, I think it makes a difference in what kind of a family that you're raised in as to the profession that you choose. I mean, there are some people that are really independent and will just go out and this is what I want to do. And we hear all the time about people that had fights with their family and almost had to break off with their family because this is what they wanted to do and their family expected them to do something else. So a family does play into it a little bit, unfortunately.
So my mother was, she had a pretty tough time in life. She went through the Depression, real difficult. And when she got married, she wanted to have doctors in her family. But we were raised in a family where doctors are next to God. You know, nothing like any of my family members. And of course, I felt the same way. I felt like I could never aspire to that kind of profession. These people are next to God. But I had that exposure when I had my stroke at 18 years of age. So I met next to God, and I figured I could do that. And my mother wanted doctors in her family. She ended up with me, my brother, who's a board certified internist, my sister, who's a nurse, who's married to a board certified occupational therapy doctor. So she got 3 doctors out of 4 kids.
That's amazing. We had 2 in our family out of 4 kids. That's terrific. A question from, who is this from? Bridget. How do I get iodine without salt or sea vegetables?
Well, it's in all your vegetables, as long as they're not grown in iodine deficient soils. There are iodine deficient soils like the Goiter Belt, which used to be in the area of Michigan, where the soils were depleted of iodine, but other soils like, you know, particularly any soil that exists by the sea, you that has iodine from the ocean, but most soils around the world, well, there's limitations of, there are goiter belts in Africa, but otherwise most soils have plenty of iodine in them. And when people ate from the local environment, everything came within 25 miles of their home. Then if you lived on soil that was deficient, you could run into a problem like the goiter belts. But that's not the way we eat these days. You eat apples grown in Washington and corn grown in Nebraska and bananas grown in Jamaica. I mean, you eat foods from all over the world grown in all different kinds of soil. So it's really never a practical issue developing mineral deficiency. Now that's mineral deficiency. Vitamin deficiency, vitamins are made by plants for their own purposes. The plant doesn't become a plant unless it has these particular chemicals in it. They're called vitamins. They're vitamins for us because we require them. They're micronutrients that we require from our food. Remember, I told you there are 13 known vitamins. 11 of them are made by plants. That's the conspiracy. One is not a vitamin, it's a hormone. It's called D. And the last one is B12, which is made by bacteria, which was never a problem until people became hygienic. And then it's still almost never a problem. The risk of B12 deficiency being a disease is far less than 1 in a million people. Even vegans, less than 1 in a million vegans will become B12 deficient, expressed as a disease, expressed as biochemical changes that you get on very sophisticated tests. That's a whole nother thing. But as far as an actual clinical problem, your risk is less than 1 in a million for B12 deficiency. 11 of the 13 vitamins are made by plants. Only plants can make essential fats. Only plants make essential amino acids. There's a conspiracy out here, probably forcing us to look at plants as our nutrition.
Wow. Let's see. What does Dr. McDougall think about the Lifeline screening tests? I'm not really sure what that is.
Well, I would guess this is a dog and pony show that comes to their community and tests.
Oh, no, I think it's that thing on TV where you can test for allergies. And
Oh, I know nothing about that.
isn't that the one that they're talking about?
I don't know what it is. I've never heard of it.
You prick your finger and you send in these blood samples and they tell you what kind of food you're allergic to or what kind of pollens you're allergic to. Well, that's what I think it is.
Okay, well, that could be.
I'm not sure.
It could be. It shows you how little I know about it, so I should probably keep my comments.
But you don't like when we look for things, because that's the problem when you go to doctors. They always find something,
Right. Yeah, if you look, you will find. It's just like one of the statistics I like to share with people is if you take 2,000 healthy people and you do CAT scans on them, you'll find 1,300 abnormalities in healthy people. You'll find 1,300 things wrong, which will require further tests and treatments, and certainly a whole bunch of worry. Oh, patient, we did this lung scan on you, and we see a little thing. It could be a nodule. It could be a cancer too. Well, those kind of findings do a tremendous amount of harm.
Those could be are really tough for people to listen to.
They're saying it's
this or it could be that, and people just I better find out that if it is or not.
Doctors trying to be as honest as they possibly could be. They give you the options. Well, could it really be cancer, doc? Well, sure, it could be cancer. And besides that, if I miss it, I'm going to get sued. So let's just say it's cancer.
People are saying it's some kind of cardiac screening.
Yeah, I don't know. But you know what?
Is that the one where you put your fingers on this test and it goes?
I don't know. I've never heard of it.
They got a lot of gimmicks out there, like this portable EKG thing.
Yeah, that's what I was talking about.
Lifeline screening is screening for arteries and for osteoporosis. The person that asked.
Well, then again, I'll go back to the dog and pony show.
Yeah.
which they come through your town and they come through with these machines, echoes and.
How do you really feel? How do you really feel? Oh my
Well,
God.
those are condemned by every aspect of standard medicine I know of as being dog and pony shows.
That's so funny.
They don't result in better health for you, but they're really, really sexy. And gee, for just $1,000, I can find out all these things about myself. Well, you don't want to know these things about yourself. There's something wrong. Yourself will tell you there's something wrong. You'll have pain. Other things about your body will be obviously changed if there's something wrong. Don't go looking for trouble because you'll find it.
Absolutely. Carolyn says, my recent TSH results were over 6 and the doctor wanted to put me on thyroid medicine. Will food reverse this?
No, it won't reverse it. Your doctor will probably continue by telling you had Hashimoto's thyroiditis, autoimmune thyroiditis, they'll say. That's where the body attacks the thyroid gland. And I went through a whole explanation when I did your show a couple of weeks ago on autoimmune diseases. I explained how the body attacks the thyroid gland. It does it by eating foreign thyroids. That means thyroids not of self, foreign thyroids. Where do you get foreign thyroids from? You get them from a slaughterhouse, but it's served to you as hot dogs and sausages. They waste nothing in a slaughterhouse. So the tails and the ears and the vaginas and the spleens and the lymph nodes that's a hot dog. Thyroid glands, hair follicles, they all go into the mixture, and you eat these things and the body recognizes them as foreign. But they're similar enough to proteins that are in your body that it gets confused, and through a process called molecular mimicry, it attacks your own thyroid gland. That's how I believe it works. Now, once the gland is destroyed, as it is, I would guess in your case, not totally destroyed, but a lot of it's destroyed, then what you do is, if you are at such a level, I think 6 is high enough to do it. My son doesn't. He doesn't treat people, I believe, if I have his present criteria in mind. He wouldn't treat somebody with a TSH of 6, but I would. Doctors are a little varied when you go to those kinds of elevations as to what you should do. It's up for discussion. I wouldn't criticize anybody one way or the other if they started supplements or not. And I always use synthetic thyroid, Synthroid. And the reason I don't give armor thyroid or natural thyroid is because it's made from the glands they get out of the slaughterhouse. You stick your nose in the bottle and smell it. Smells like dead pigs.
So gross that they still do that.
Yeah. And it spreads microbes. That's the problem. It's prions that cause mad cow disease, leukemia viruses, etc. When you eat these things from cows, cancer-causing viruses, boy, oh boy, that doesn't make a lot of sense, does it?
No. We had a funny comment from Yossi when you were saying what hot dogs are made from. And she writes, well, that's why they're called wieners.
No, I wouldn't. I wouldn't carry that far. Thank you very much.
Oh, I love it.
People are asking, if you stop smoking, how long does it take for the damage to be reversed? And is it always reversed?
Well, they say at 7 years, you suffer the same statistics as somebody who never started smoking. So if you survive for 7 years, pretty much your statistics are pretty favorable. I've been.
Oh, that's good.
Yeah.
We've been non-smokers for way more than 7 years.
Yeah, October 20th, 1972, at 7 in the morning, I stopped smoking.
God, you remember everything.
Because it was a big deal
yeah.
to overcome that addiction. It was one of the hardest things I ever did. I was in my mid-20s then.
So that'll be 50 years we haven't smoked.
Yeah, well, October 20th, 1972 is, 50 years ago, I stopped smoking.
Wow. Do you ever, I'm sure you have an iPhone. Do you ever take videos of anything? Do you ever do that?
Yeah, I do. He doesn't.
Why don't you, wouldn't it be cool if you could live stream from your 50th medical school reunion?
Oh, all right. If I go. I'm a little concerned about traveling these
Oh,
days.
but if you do go, glad we would love to see that, So I've been asking people like what they would like to see, because you're going to be back in a couple of weeks and we're getting a lot of things. We're getting GI, so really, they don't really care. They just love spending time with you. How I have a show at 2, but if you'd like to go longer, or we could say, I think
let's let you go. I think our audience has put up with enough.
Yeah, it's so hard saying goodbye to you guys.
Yeah,
It's just so much fun. The time just really flies by,
Well, it is fun, AJ, and again, I really appreciate you making your audience available to us. And
well, they seem to really love you because they stay on the whole time, and we always get at least 500 when you're on, sometimes more.
Well, we'll see you in a couple of weeks then.
Yeah,
well, and he'll let you know what he's going to talk about.
Yeah, I'll let you know.
Right. We're competing right now because there's this online conference that's running that you are a speaker in. I just spoke at, called The Real Truth About Health. So that's why a couple hundred people are over there watching, but I'm sure they'll watch the replay.
All right. Talk to you in a couple of weeks.
Thank you so much.
Bye-bye.
And thanks all of you for watching another episode of Chef AJ Live. Please come back in 30 minutes when my guest is Nate Maris, and he is going to be making